So we are live.
Yes.
We will wait for 1 or 2 minutes, then we will start.
Ramakant sir, good evening, welcome.
नमस्कार भांडारकर.
बऱ्याच दिवसांनी दर्शन होते तुमचं परत.
नाही हो, दर्शनाचं अतिदर्शन झालंय, त्यामुळे थोडं सबॅटिकल पाहिजे.
ओव्हर एक्सपोजर.
ओव्हर एक्सपोजर.
पिक्चर म्हणून चालत आहे, जास्त एक्सपोज झालं.
Hello, good evening, Ramakant sir.
अरे विकास, गुड इव्हनिंग. व्हेरी नाईस ऍक्टिव्हिटीज. I should congratulate IIP Raigad and NMAP. Wonderful.
Thank you, sir.
Very good. Wonderful.
Good evening, Ramesh Patel sir. Thank you. Good evening, sir.
गंगुले जी, आपण सुरू करू.
In a minute, Jay. In a minute. In a minute. Mohanty sir. Good evening.
Good evening.
We had done this quiz with RMA on antibiotic awareness 2 years back, 21 November, 9 November. It was a wonderful experience at that time. We got award at state as well as national level for this celebration.
Wow. Wonderful.
So let us start with our slide presentation first. And
Close the door. Don't close the door.
Asato ma satgamaya, tamaso ma jyotirgamaya, mrityorma amritam gamaya.
गणनायकाय गणदैवताय गणाध्यक्षाय धीमहि गुणशरीराय गुणमण्डिताय गुणेशानाय धीमहि गुणातीताय गुणाधीशाय गुणप्रविष्टाय धीमहि एकदन्ताय वक्रतुण्डाय गौरीतनयाय धीमहि गजेशानाय भालचन्द्राय श्रीगणेशाय धीमहि
एकदन्ताय वक्रतुण्डाय गौरीतनयाय धीमहि गजेशानाय भालचन्द्राय श्रीगणेशाय धीमहि.
so welcome all to Antimicrobial Awareness Week 2023. The theme is preventing antimicrobial resistance together, avoid antibiotic abuse quiz. and we welcome all the team, all the experts to this quiz. Yes.
The development of antimicrobial resistance, that is AMR, occurs when pathogens such as bacteria, virus, fungi, and parasites evolve to become immune to treat with antimicrobials, causing drug resistance, especially with the rapid global spread of multi and pan-resistant bacteria, for which current available antibiotics are ineffective. Due to this, antimicrobial drugs lose their efficacy, making the treatment more challenging or impossible in some cases. AMR is a threat to humans, and plants, animals, and the environment. It affects all of us. This brings the necessity for the antimicrobial resistance awareness. Good evening, everyone. In view of Antimicrobial Awareness Week celebration, keeping in mind the theme of celebration, preventing antimicrobial resistance together today, Raigad IIP together with RMA has arranged a very special quiz on avoid antibiotic abuse for our dear lifelines of any city, town and village, our dear general practitioners. I welcome all the respected dignitaries and guest of honor, both the experts of today and Maha IP Secretary General, President and Secretary of Raigad IP and President and Secretary of RMA, as well as member of Maha IP, Raigad IP and RMA, and the attendees for today's quiz program. Now I welcome and request immediate past President, Maha IP, as well as coordinator of today's quiz, Dr. Hemant Gangolia sir, to proceed and welcome the dignitaries, followed by introduction and starting today's quiz. Over to you, sir.
Thank you, Dr. Neha. So I will request our President of IIP Raigad, Dr. Vikas More, to give his welcome speech. Dr. Vikas.
सर्वप्रथम IIP रायगड तर्फे तुमचं सर्वांचं हार्दिक स्वागत. आणि सध्या तुम्हाला माहिती आहे की सध्या अँटीबायोटिक अवेअरनेस वीक चालू आहे. त्या निमित्ताने आम्ही हा एक वेगळे इनिशिएटिव्ह घेऊन आलो आहेत. त्यासाठी स्पेशली हे इनिशिएटिव्ह डॉक्टर गांगुलिया सर आणि डॉक्टर जय सर यांनी युनिक पद्धतीने आणलंय. त्या निमित्ताने असं होईल की आपल्याला बरेच काही डिस्कशन करायला मिळेल, नवीन गोष्टी शिकायला मिळतील. आणि पेडियाट्रिक एक बियॉन्ड ड्रग्स पण आहे, बरेच काही हे तुम्हाला बघायला मिळेल. मी सर्वप्रथम आमचे आदरणीय डॉक्टर रमाकांत पाटील सर, महाराष्ट्र आयपीचे अध्यक्ष, ते जॉईन झालेत आपल्याला ब्लेसिंग देण्यासाठी. मी त्यांचं स्वागत करतो. आपले आदरणीय निरुषितुल्य निमान मोहंती सर, आदरणीय डॉक्टर महेश मोहिते सर, हे पण आपला एक्सपर्ट म्हणून जॉईन झालेले आहेत. ते आपल्या सर्व क्वेरीज, शंका निरसन करतील. नंतर आपल्यासोबत डॉक्टर रमेश पटेल सर आहेत. ते आपल्याला ब्लेसिंग देण्यासाठी आलेले आहेत. आणि ते हे बायस असू नये म्हणून ते RMA तर्फे सर आहेत. कारण असं होऊ शकतं की जे क्वेश्चन्स आहेत कोणाला असं वाटू शकतं की एखाद्या टीमला डिफिकल्ट क्वेश्चन आहेत, एखाद्या टीमला सोपे क्वेश्चन्स आहेत. असं होऊ नये ह्यासाठी शफलिंग हे रमेश पटेल सर करतील, म्हणजे कोणाला असं बायस वाटू नये. आणि स्पेशली डॉक्टर सिद्धेश मेहता सर, डॉक्टर सत्या ठाकरे सर, डॉक्टर प्रणित दिघे सर, डॉक्टर मयूर कल्याणी सर, डॉक्टर मोहन मेहता सर आपापल्या टीम सोबत आहेत. मी खूप एक्सायटेड आहेत कारण मी सगळ्यांना ओळखतो, सगळे माझे मित्र आहेत. मी 2016 पूर्ण रायगड जिल्ह्यामध्ये फिरलो होतो. सगळ्यांना मी भेटलो, सगळ्यांना बाय फेस ओळखतो आणि सर्वांना स्क्रीनवर बघताना मला प्रचंड आनंद होतोय. आणि ही संधी मला IIP थ्रू मिळाली याचा मला अभिमान आहे. तर मी परत एकदा गांगुले सरांचा आभार मानतो की इनिशिएटिव्ह तुमच्यामुळे आज मला करता आलं आणि मला त्याचं क्रेडिट मिळतंय. रमाकांत पाटील सरांना नेहमी वाटतं की मी हे काम करतो, पण माझ्याकडे टीम एवढी चांगली आहे की ते एवढं काम करतात की मला क्रेडिट मिळतं. सो आय एम सो प्राऊड ऑफ यू. ओव्हर टू यू सर.
थँक्यू डॉक्टर विकास. आणि स्वतःला मी कधी कधी सौभाग्य मानतोय की कर्जत मेडिकल असताना प्रेसिडेंट होतो 2004 आणि 2003 साली. म्हणजे एक तालुकाच असोसिएशन, नंतर RMA रायगड मेडिकल असोसिएशनचा प्रेसिडेंट होतो 2010 मध्ये, आणि नंतर 2022 मध्ये स्टेट महाआयपीचं प्रेसिडेंट होतो. तर मला असं वाटतं की खूप आनंद होतो की माझ्या कर्जत तालुक्याचे टीम पण इकडे आहे, RMA ची टीम पण आहे, आणि महाआयपीचे मोठे ऑफिस बेअर सुद्धा आहेत. तर आय विल रिक्वेस्ट अवर RMA प्रेसिडेंट ऍट प्रेझेंट Dr. Arun Kumar Bhagat sir to give his blessings. Dr. Arun sir.
Good evening, sir.
Yes.
Good evening, respected chief guest, Dr. Ramakant Patil, sir. Expert Dr. Mahesh Moite, sir. Dr. Mohanty, sir. Dr. Vikas More, sir. Dr. Ajay Koli, sir. Dr. Hemant Gangolia, sir. Dr. Jay Vandarkar, sir. Team leaders, as well as participant and all event organizer. I, Dr. Arun Kumar Bhagat, first of all, I would thanks to organizing team IAP Raigad for conducting this much needed antibiotics awareness quiz. Best of luck for all the participants. Thank you, sir.
अरुण सरांचं म्हणायला, ही इज अ नगरसेवक, कॉर्पोरेटर इन पनवेल महानगरपालिका, अँड फ्रॉम पॉलिटिकल अँड इज ऍक्टिव्ह पॉलिटिशियन. आणि आम्ही लहानपणी नेरळला एकत्र राहायचो, एकत्र असायचो. सो वी नो इट व्हेरी वेल. थँक्यू सर फॉर स्पेअरिंग अ व्हॅल्युएबल टाइम. मला माहिती आहे तुमचा वेळ खूप बहुमूल्य आहे, आणि तुम्हाला अजून एक मीटिंग अटेंड करायची, तर वेळात वेळ तुम्ही काढून आला त्याच्यासाठी खूप खूप धन्यवाद अरुण सर. हा सर.
Thank you, sir.
So thank you very much. With that, we are very fortunate to have our dynamic president of Maha State Academy of Pediatrics, IIP, Dr. Ramakant Patil sir. He was also executive board member of CIP in 2022 and 23, and he is a dynamic personality, well equipped with the academics as well as powerful English orator, I can say. So I would like Dr. Ramakant sir to give his blessings to this quiz.
Yes, sir. First of all, I am really envious about Raigad branch, IMA. They are having excellent academic programs, and you have got a president in us who is giving all the credit to his team. But the leader is always, even if he is only the face, but he is there to bring all the people together, giving due respect to seniors and taking all the colleagues along with him and the team. And really, the way journal journey, all the Maha IAP online activities which were started by Dr. Hemant Gangolia and his teams, and all the 4 programs we have continued, adding 2 more programs of path for adolescents and immunization dialogue, and all remaining 4 programs we have continued, and journal journey and this different. And what we can say about this antibiotic stewardship and rational use and preventing antibiotic resistance, what is the theme of this week. And I really congratulate Raigad Medical Association led by Bhagat sir, Raigad IAP ably led by Dr. Vikas More and Ajay Koli, and very well supported by Rushitulya Advaryu, Dr. Nimen Mohanty sir, my very dear friend, philosopher, Dr. Mahesh Moite, my immediate past president, Dr. Hemant Gangolia, all the 5 teams of different regions of Raigad IAP, their leaders and their mentors. It is really heartening, and it is really proud privilege to attend such a out-of-box academic activities. We always talk about the antibiotic stewardship, but if we inculcate it, and if we have some mistakes in quiz, then it will be etched on our mind that will not be repeating. And whatever academics and discussion should be brought to our consulting room prescription. So most important is that we have to responsibly prescribe it, review it, reduce it, refine it, and replace it. And what is more important again is right dose. Most important is de-escalation, properly patient directed, and right duration. We all are aware now that so many illnesses that even in pyogenic meningitis, duration of antibiotics has come to 7 to 10 days, even 5 days in some cases. And for otitis media, it is 10 days. So this is, we have to again, because as it has been said that in 2 decades, 50% whatever we have learned has become irrelevant and 50% has changed. So constant updating and refreshing and our knowledge is most important. And to keep our clinical pulse bounding and well, such a sort of activities are required. And kudos to Raigad IAP and their able leaders and patrons and guiding forces like Dr. Mahesh, Dr. Nimen Mohanty, Dr. Hemant Gangolia, Dr. Chandorkar, Dr. Dighe, and so many people. I will please forgive me if I forget some names like Dr. Mehta and Dr. Sunil Sheth and Dr. Dighe. So these people are really taking a lot of efforts, and will many branches in Maharashtra and all over India should definitely emulate Raigad IAP to have these academic activities and most relevant activities for patient management. So thank you for giving me an opportunity to interact with you. And I am all ears to going to listen this quiz and how much I really know about these questions. So that will be a good insight. Over to you, Gangulia sir. Thank you for giving
Thank
me
you,
an
Dr. Ramakant sir. You are as good as an expert, and if you are there, as along with Dr. Mahesh Mohanty sir, Dr. Nimen Mohanty sir, you are free to contribute your opinions. सरांनी जसं सांगितलंय, today's this year's theme is preventing antimicrobial resistance together. Together शब्द हा खूप महत्वाचा आहे, आणि मला असं वाटतं each one and all of us are responsible. We are pediatricians also are responsible for all these resistance. Each and every one of fraternity, medical fraternity. पण त्यात आपण न कळत कळत शिकत वरच काय सुधारत जायला पाहिजे. आणि प्रत्येक वर्षी हा अवेअरनेस वीक सेलिब्रेट केलं जातं. प्रत्येक वर्षी वेगळं थीम दिलं जातं, आणि थीमच्या अनुषंगाने आपण त्याला असा विचार करतो आपण इम्प्रूव्ह करायचं. आणि बऱ्याच वेळेला गोष्टी अँटीबायोटिक लिहायचं की नाही लिहायचं हे महत्वाचं असतं. लिहिलं तर बरोबर लिहायचं, आणि लिहिलं तर बरोबर ड्युरेशन जातील. तर हा जो थीम आहे ह्याच्या संघाने आपण पुढे चालूया. आणि वी वेलकम ऑल दी मेंटर्स ऑल्सो ऑफ ऑल दीज टीम्स, respectively Dr. From Dr. Uddhav Khilare from North Raigad, Dr. Pramod Wankhede sir from East Raigad, Dr. Rajendra Chandorkar from West Raigad, Dr. Sunil Sheth from South Raigad, and Dr. Anand Wagre sir from Central Raigad. Welcome all the mentors, and as we go through the quiz, we will take the blessings from experts to our Dr. Mahesh Mohanty sir as well as Dr. Nimen Mohanty sir. Before we will start the quiz, we will just take few words from them also. So let us introduce ourselves, and so I will just share the slide and we will go ahead, and also, of course, we will have the opinions and words from mentor too during the process of the quiz. And so I will just share and then we'll go ahead. So we have team North Raigad. The team leader is Dr. Satya Thakre. I will request Dr. Satya to introduce his team. You can introduce your team. Dr. Satya sir, please. Or any one of this team is there. Dr. Tushar, Dr. Anil, Sachin.
Sir, Dr. Khilare here. Can I introduce them?
Yes, go ahead. Our mentor for North Raigad, Dr. Uddhav Khilare sir. Please go ahead.
सर नमस्कार सगळ्यांना. या ऍक्टिव्हिटीसाठी सगळ्यांचं वेलकम करतो. आमची टीम डॉक्टर सत्या इज देअर, डॉक्टर तुषार बोरकर, डॉक्टर अनिल भाले and Dr. Sachin Khorde. They are all more than 20-year-old practitioner, almost more than 20 years, and they are very good practitioner. With them, I'll say all the best to all teams. Thank you, sir.
Thank you, Dr. Uddhav. Our next team is Team East Raigad. I will request Dr. Siddesh Mehta or mentor, Dr. Pramod Wankhede sir, to introduce his team. Please, Dr. Wankhede sir.
Hello, good evening all.
Yes.
My team is East Raigad team, and our participants are Siddesh Mehta, Bhavesh Oswal from Karjat, and Sunil Devdikar and Praveen Porwal from Khopoli. All are well experienced and doing well in practice. Thank you very much.
Thank you, Dr. Wankere, sir. Dr. Siddesh Mehta is the son of Dr. Mehta, sir. Very senior. He was gold medalist from GMC. And आमच्याकडे एक बस स्टॉप आहे, त्याला आम्ही मेहता बस स्टॉप म्हणून पेशंट लोक बोलायचे आणि ते उतरायचे त्यांच्या ओपिनियनसाठी. जस्ट बाय द वे इन्फॉर्मेशन साठी. आवर नेक्स्ट टीम इज टीम साउथ रायगड. डॉक्टर सुनील सेठ, कॅन यू इंट्रोड्यूस युअर टीम प्लीज?
हॅलो, हा, मी डॉक्टर मोहन मेहता.
येस सर.
बिपिन मेहता, डॉक्टर तृप्ती कोल्हे आणि डॉक्टर सागर रहाळकर असे आम्ही 14 जण फ्रॉम साऊथ रायगड. मी गेली 41 वर्ष प्रॅक्टिस करतोय. बिपिन सर पण आमचे 35 वर्ष प्रॅक्टिस करतात आणि हे दोघे ज्युनियर आहेत आम्हाला.
थँक्यू व्हेरी मच सर. एवढं वर्ष प्रॅक्टिस केल्यानंतर सुद्धा तुमचं इंटरेस्ट क्विज मध्ये बघितलं तर खरोखरच आनंद झालाय आणि ऑल दी बेस्ट. Our next team is Team West Raigad. It is Dr. Rajendra Chandorkar is a mentor for this, and Dr. I will request him to please introduce his team.
Good evening. First of all, let me take this opportunity to congratulate IIP Raigad and RMA for this wonderful activity. Friends, our team is a mixed blend of experience and youth. There are 3 youngsters who are fortunately my students. And barring Dr. Ravi Matre, he's a senior general practitioner over here, and Dr. Mayur, Dr. Amit, and Dr. Omkar, they are my students. So, though it is a friendly affair, I have told them that we are going to put our maximum efforts, and we will give this quiz, and we will come out with flying colors. Thank you, and best wishes to all the teams.
All the best wishes to Team West Raigad. And then we have Dr. Anand Wagle, sir, mentor of Team Central Raigad. I request Dr. Anand, sir, please introduce your team, and you can tell the places also where they practice. Dr. Anand, sir, from Roha. Is
Hello.
Dr. Anand there? Yes.
Start. Dr. Anand Wagle speaking. We have got 4 team members. Pranit Dighe He's been practicing for almost 10 years at Pollard, and quite young and developing into a senior now. He's a team leader. Then Dr. Nikhil Garude from Nagotna, Dr. Mukesh Singh from Roha, and Dr. Rohit Shirsagar. He's also practicing in Roha. So they're all medium level practitioners and who have been practicing for the last 8 years to 15 years range. This is a wonderful initiative by RMA and IIP combined, and hopefully it should help us all to improve and utilize the learnings into our practice. Thank you.
All the best wishes. Thank you, Dr. Anand, sir. So all the best wishes, all the 4 teams, 5 teams. But just a word of caution, mentor, please, while they participate in the quiz, do not give the hints to their answer. So moving ahead, rules and regulation for the quiz. Actually, during to yesterday's rehearsal, we said these are rules and regulation. But for short introduction of rules and regulation, I will request my quiz master, Dr. Jay, sir, to just tell about the rules and regulations briefs.
Thank you. Good evening, everybody. Welcome to this wonderful, very important quiz. First of all, I will thank you, Hemant Gangolia ji, first for doing everything. सगळे जे पीपीटी आहे पूर्णपणे गंगोलाजी त्याचे काय डिजिटल तुम्हाला जे काय आवाज येत आहेत सगळं काय केबीसीचं तुम्हाला म्युझिक वगैरे सगळं येईल. त्याचं जे काय टेक्निकल आहे ते सगळं गंगोलाजी केलंय. बेसिक पीपीटी विथ लॉट ऑफ स्पेलिंग मिस्टेक मी त्यांना पाठवून दिलं होतं, त्यांनी सगळं करेक्टेड करून केलेलं आहे. आणि so that if there is quiz, is competition, yes, it is competition though, so certain rules are there. So already there are 5 teams with 4 members in each team. There will be total 2 rounds for each team, and we are going to call in first round, we will call every team at once and going to ask 4 questions at a stage. तुम्हाला 10 पॉइंट करेक्ट आन्सरला असतील आणि 0 पॉइंट फॉर द रॉंग आन्सर. टाइम ड्युरेशन 15 सेकंद. 1 वर्ड ऑफ कॉशन. जेव्हा जी टीमला आपण इथे इन्व्हाइट करणार त्या टीमने फक्त त्यांचा व्हिडिओ आणि ऑडिओ ऑन ठेवायचा आहे, बाकी सगळ्यांनी व्हिडिओ आणि ऑडिओ बंद करायचा आहे. नो प्रॉम्प्टिंग दॅट इज. अँड अनदर थिंग, अनलेस अंटिल आय से युअर टाइम स्टार्ट्स नाउ, तोपर्यंत डिस्कस करायला चालू करू नका. आणि तर तुम्ही जर बोलायला चालू केलं तर माझा विचारलेला प्रश्न बाकीच्यांना पण व्यवस्थित ऐकू येणार नाही. तर दिस व्हेरी इम्पॉर्टंट असं म्हणेल की सूचना आहे की मी जोपर्यंत तुमचा टाइम स्टार्ट समजा तुम्ही डिस्कस करा अँड अपॉइंट ओनली वन लीडर एनी वन यू अपॉइंट की त्या चौघांना कोण फायनल आन्सर देणार ते सांगितलं की आवर आन्सर इज धिस राईट. तो टायमर संपण्यापूर्वी आणि तुम्हाला इनफ टाइम येणार आहे आणि दॅट इज थिंग. आणि सेकंड राऊंड विल बी दिस इज अ रॅपिड फायर. Each team will call at once. There will be 8 questions. We are going to get 1 minute. Timer थांबेपर्यंत तुम्हाला 8 प्रश्न विचारणार. Most important त्यात पण तुम्ही appoint only one person and you have to answer something. पास येत नसेल तर पास म्हणा, येस नो जे काय सांगायचं त्याशिवाय पुढचा प्रश्न मी विचारणार नाही. आणि देर इज ओनली थिंग महत्वाचं जे आहे की जी टीम आहे त्या टीमनी व्हिडिओ आणि ऑडिओ ऑन ठेवायचं आहे. किंवा द टाय क्वेश्चन्स ऑल्सो. मला असं वाटतं की बऱ्यापैकी क्वेश्चन फार सोपे आहेत. सो दॅट आय हॅव द विनर विल डिसाइडेड बाय ऍडिंग 2 राऊंड्स म्हणजे मार्क ऑफ 2 राऊंड्स. बट इन केस टाय जर झालं तर विल गोइंग टू फॉर अ टाय क्वेश्चन्स. पण टाय व्हायची शक्यता बरीच आहे कारण आय हॅव केप्ट ऑल क्वेश्चन्स आर प्रॅक्टिकल वन्स. डे टू डे आपण प्रॅक्टिस बघतो. नॉट ॲट ऑल एनी थेरॉटिकल. इट इज अ रुटीन क्वेश्चन्स. म्हणजे तुम्हाला असं वाटेल की क्विज में कुछ दम नहीं है. बट येस देर आर हिडन. I want to take you a stimulate for that, do a proper practice as well as already said by Dr. Ramakant, where to go. बऱ्याच वेळा अँटीबायोटिक वापरण्यासाठी आपल्याला वाटतं फार आपल्याला विचार करावा लागत नाही, पण न वापरण्यासाठी जास्त विचार करावा लागतो. तर असा बी प्लॅन लाईक दिस. सो टू अगेन टू हेमंत गंगुलेजी, ते आर द रूल्स.
So this is the final internet connection, audibility, visibility, participant is
ते पण आहे.
responsibility.
आणि महत्वाचं की वेर म्हणजे आपलं क्विज बरं आहे की पॉप्युलर असतं, लॉट ऑफ व्ह्युअरशिप असते. दो देर इज कॉन्ट्रोवर्सी. फक्त मला ते फार आर्ग्युमेंट आपल्याला ऑनलाईन काही फारसे नकोत, बिकॉज वी आर ऑल फ्रेंड्स अँड जस्ट एन्जॉयिंग अवेअरनेस दिस क्विज. ओके,
Thank
थँक्यू.
you, Dr. Jay. And we have 2 experts here, informer Dr. Mahesh Moite sir and Dr. Nimen Monti sir. Dr. Nimen Moite is a professor emeritus from MGM Medical College, and he is a gem person, and he can say a few words, sir. Please, sir, before we proceed.
Thank you, friends, that you have invited me today. But I'm really having a lot of bronchospasm, so I will stay live with there. So Dr. Moite is there. We'll help each other and do it today. And all the best to the participants and the contestants. Thank you.
Thank you, sir. In between, if at any point of time, if you would like to give crisp take-home message, you are welcome, sir. And if any ambiguity is there in any questions, so we will take your help, sir. And our next expert is Dr. Mahesh Moite. Probably everybody in Raigad, everybody in Maharashtra state, everybody in India knows him very well. He's a good academician, excellent academician. And I will just request sir to give his blessing, sir, before we proceed.
क्विकली फक्त एकच सॉर्ट ऑफ रिमाइंडर की वॉर्निंग म्हणा. अँटीबायोटिक आपल्याकडे येऊन अजून 100 वर्ष पण झालेली आहेत. पेनिसिलिन पहिलं होतं 1930 मध्ये. अजून आपली 100 वर्ष झालेली नाहीत आणि आपली जवळजवळ सगळी अँटीबायोटिक जी शक्य आहेत ती सगळी वापरून झालेली आहेत. आता आपल्याकडे जे चालली आहेत ते आपण रियूज मध्ये आणली आहेत. कोलेस्टिन रियूज मध्ये आणले, नवीन पहिले, कारण आता जे नवीन आहेत ती चालत नाहीयेत. आणि हे असं होण्याचं कारण ओव्हर यूज ऑफ अँटीबायोटिक्स आहे. इंडिया जगामध्ये अँटीबायोटिक वापरणारा सगळ्यात मोठा, जास्तीत जास्त अँटीबायोटिक वापरणारा सगळ्यात मोठा देश आहे. त्याला कारण अनरेग्युलेटेड प्रिस्क्रिप्शन प्रॅक्टिसेस. त्यामुळे मुळात अँटीबायोटिक काही मूळ क्वेश्चन घ्या. हा पेशंट इन्फेक्शन आहे का? तो इन्फेक्शन असेल तो बॅक्टेरियल इन्फेक्शन आहे का? तो बॅक्टेरियल इन्फेक्शन असेल तर त्याला अँटीबायोटिकची तरी गरज आहे का? असेल तर कुठलं अँटीबायोटिक योग्य आहे? कुठलं अँटीबायोटिक योग्य आहे तर ते किती दिवस द्यायला हवं? किती लवकर संपवायला हवं? हे जर आपण प्रत्येकाने रॅशनली वापरायचं म्हटलं तर सहज शक्य आहे. महत्वाचं, मी नेहमी हा प्रश्न विचारतो की जेव्हा मी म्हातारपणे 70, 80, 90 मध्ये आयसीयू मध्ये पडलेला असेल आणि कुठलं इन्फेक्शन सेप्सिस झालं तर त्यावेळी कुठलं तरी अँटीबायोटिक माझ्यासाठी काम करेल का? नंतर त्यावेळी जर अँटीबायोटिक काम करणार नसेल तर त्याला मी आज जे करतोय ते जबाबदार राखणार आहे. तुमच्यापैकी कित्येक लोक माझ्यापेक्षा 20-25 वर्षांनी यंग आहात, त्यावेळी तुम्ही जेव्हा त्या स्टेजला असाल त्यावेळी कदाचित जगात अँटीबायोटिक उपलब्धच नसेल. आणि ते जर तुम्हाला टाळायचं असेल तर आत्ताच अँटीबायोटिक खूप केअरफुली वापरा. IAPने मुवमेंट जवळजवळ 10 वर्षापूर्वी सुरू केलेली आहे. यूज अँटीबायोटिक रिस्पॉन्सिबली. मला असं वाटतं होल थिंग इट्स अ कलेक्टिव्ह एफर्ट. It's not one individual who can change the whole scenario. All of us have to use antibiotics extremely carefully avoid as far as possible, use them rationally. And I think this particular effort by IIP, I request the leaders to continue every year so that we can have more, and it's kind of a general or more kind of a universal practice which should be done, that we should try and avoid antibiotic use in our practice. Thank you, Hemant. Please.
थँक यू व्हेरी मच सर. सरांनी जे सांगितलं त्याला अजून एक दोन वाक्य फक्त जोडताना की फीवर इज नॉट इक्वल टू अँटीबायोटिक, हे लक्ष सर्वांनी ठेवायचं. अँड सेकंडली जे सरांनी सांगितलं अनरेग्युलेटेड प्रिस्क्रिप्शन, वी शुड ऑडिट प्रिस्क्रिप्शन अवरसेल्स ऑल्सो ऍट द एंड ऑफ द डे. आणि असं म्हटलं जातं की जेव्हा तुमच्या दिवसाभराच्या 100 प्रिस्क्रिप्शन असतील त्यातले 10 ते 15% मध्येच तुम्ही अँटीबायोटिक लिहिलं तर तुमचे प्रिस्क्रिप्शन जे आहे ते खरोखरच चांगले असं म्हणतात. एक स्टॅटिस्टिकल स्टडी आहे. थँक्यू सर फॉर युअर ब्लेसिंग्स अँड वाईज वर्ड्स. विथ दॅट वी विल जस्ट गो. सी वी आर हॅव्हिंग 5 teams. So I have prepared the whatever the quiz is there. This is as per the teams, but we should not get biased and everything should not get. So we will change the name of the team, and for that I will invite Dr. Ramesh Patel sir. He is one of the patron of Raigad Medical Association, past president of Raigad Medical Association in 2010 and 2011. I welcome Dr. Ramesh Patel sir to do this honor of the naming ceremony. Sir, are you there? Because if I am sharing the screen, I cannot see you. Are you there, sir? Dr. Jay,
Yeah,
Dr. Neha can help me
Yes.
whether sir is there or not.
He is there.
Yes, sir. Are you ready with
Sir,
the? Sir,
Yeah,
are you ready with the?
I'm ready.
sheets? Yes, sir. Thank you very much. So the first name what we are going to give out to our team is penicillin. So I will request our sir, Dr. Ramesh Patel sir, to pick one of the sheet and just let me know which team is penicillin. Sir, you can show the bowl that there 5 sheets are there in that.
This is a bowl. Can you see?
Yeah.
Yes, sir. Yes, sir.
There are 5 sheets inside. I'll pick up one of them. The sheet says Central Raigad.
So Central Raigad team leader, Central Raigad, just acknowledge your new name. What is your new name? Central Raigad team leader, Dr. Praneeth.
Penicillin.
So
Penicillin.
Yes, henceforth you will be called team penicillin.
Penicillin. Okay.
Next name is cephalosporin. Yes, Dr. Ramesh Patel sir is a renowned surgeon from Panvel. Yes, Dr. Ramesh Patel sir.
The next name is West Raigad.
Sir, please.
West Raigad.
West Raigad. So team leader of West Raigad.
Yes, sir. Got it.
What is your new name, please?
Cephalosporin.
Yes, thank you very much. So for the third name is macrolides. So I will just again request Dr. Ramesh Patel sir to do the honor of knowing the third team name.
The third team name would be North Raigad.
So North Raigad team leader Dr. Satya is there, or any one of them? Any one of them from North Raigad?
Yes, sir. Macrolide.
Macrolides. Please acknowledge your new name. Our next name is quinolones. Yes, Dr. Ramesh Patel sir.
Next is East Raigad.
So East Raigad captain, team leader, who is East Raigad? Dr. Siddesh. What's your new name? Quinolones. And the last name which is remaining is beta lactams, and that is the last team remaining, the last whatever is in the bowl. Dr. Ramesh Patel sir.
South Raigad.
So South Raigad team leader. Please acknowledge your new name, Dr. Mayur.
Beta lactam.
So Dr. Mayur, you are beta lactam. So with
Sir,
this,
Dr. Sunil Shet, sir, माझा आहे.
Sunil sir, sorry. South Raigad, Dr.
Sunil Shet.
Mohan Mehta.
Beta lactam.
So the new teams, I will just recapitulate. Penicillin is Central Raigad, cephalosporin is the West Raigad, macrolide is the North Raigad, quinolones is the East Raigad, beta lactam is the South Raigad. Okay, so these are the new names for your team, and with this we'll proceed further. Dr. Ramesh Patel, I will request Dr. Ramesh Patel sir to give his blessings. Yes sir, please.
Hello everybody.
It's nice to see everybody together in a joyous mood and a competitive mood. I think this topic has been in vogue for, I think, so many years, as Dr. Mahesh Mohit has said, that if you need to use an antibiotic for yourself, if today you don't use it judiciously, you will have nothing left when you need antibiotic. Because as a surgeon, we have seen now resistance to tigecycline, vancomycin, and emergence of a superbug, which is resistant to virtually every antibiotic available on this earth. And unfortunately, there are not many, or say, I would say few molecules in pipeline, which gives us hope of a new antibiotic in a near era. So be very judicious when you see. I think the problem is, as somebody rightly said, I think Hemant said, that fever is not equal to antibiotic. But what happens is that there is some insecurity amongst the newer people that if I don't write antibiotic in a patient of a fever, my colleague will write and I'll lose that patient. Don't have that in your mind. Be judicious when you're using antibiotic, where your near and dear one may need it, and it will be difficult for them to get an antibiotic where they are sensitive, where the bugs are sensitive. So congratulations, IIP Raigad, for conducting such a wonderful quiz, and all the best to the participants. Thank you. God bless you.
Thank you, Dr. Ramesh Pujari, sir, for your
Thank you, sir.
valuable time. And with this, we finish the introductory part. I will just make one request to our experts. If at any point of time, at any point of question, you feel that there is any ambiguity, please you can intervene, and also you can give brief, crisp take-home messages related to the case, whatever is present in the form of question. So clear take-home message should go. I will request experts to do the needful. As well, I will request if Dr. Ramakant Patil sir is there, he can also give his crisp take-home messages regarding any one of the question. So we thank for the presence of the experts, Dr. Nimen Monti sir, Dr. Mahesh Mohite sir, as well as Dr. Ramakant Patil sir. So with that, we move forward with the round one of this quiz. As well as I will request Dr. Neha madam, who please keep the track of the score. So at the end of the round, you can just tell the which team has scored. Probably you must have noted the which team is which rename. So please, at the end of the round, you can tell the score. So this is request to Dr. Neha madam.
Hemant, sorry, I have to leave. Can I leave?
Yes, sir.
Dr.
Thank
Ramesh
you,
sir,
sir.
yes,
Thank you.
yes, sir, yes.
Yeah, okay. Thank you. All the best.
So with this, I will request Dr. Jay to carry forward from here onwards. Yes, Dr. Jay.
Yes, thank you. Everybody is waiting like a World Cup final, right? So team penicillin, Central Raigad, are you ready? Team leader
Yes,
कोण
sir.
आहात?
Hi,
You need
sir.
to acknowledge. Yes. Who is going to answer? Answer, final answer कोण देणार आहे तुमच्यातलं?
Pranit Dike. Pranit
Dike,
Dike.
I will concentrate on you. Please remember, when I say your time starts now, तेव्हा तुम्ही डिस्कस करू मग our final answer असं द्यायचंय. तुम्हीच बोलायचं, right? तर ते आणि ते आन्सर तुमच्या तोंडात फर्स्ट येईल तेच फिक्स होणार. यू कॅनॉट चेंज द आन्सर. एक आन्सर एक पासून बी ला नाही जाता येणार तुम्हाला. एकदा ए सांगितलं की एस पकडावं लागेल. तर प्रायर डिस्कशन यू हॅव इनफ टाइम. सो here's the first question of this opening ball of this today's quiz is from quiz our bank. Dr. Hemant, please put the question on the screen. A 15-month-old boy brought with complaint of watery loose motions and mild fever and temperature of 100.4 degree Fahrenheit. Dehydration was present. System examination within normal limit. What are the treatment options? The options are A. Syrup cefixime, ORS, syrup paracetamol. Option B. ORS, syrup zinc and follow-up. Option C. Probiotic, no milk. And option D. Syrup Norflox and ORS. Your time starts now.
Sir, C.
Okay.
C.
You are saying your answer is C. C na
Yes, sir.
probiotic with no milk, right?
Yes.
Okay.
Yes, sir.
So I am going towards our Neon Mahanti sir. Sir, ये जो patient है, clinically he is in a viral diarrhea with dehydration. Our team has chosen the probiotic and no milk. please explain. Just we will correct the see what is the exact answer. Quiz bank, please confirm it. Computer, बताइए. So the real answer is overall rehydration, ORS, syrup, zinc, and aloe, right? निमन मोदी
Yes,
सर,
yes.
लेकिन सर मैं सिफिक्सिम देना चाहता हूँ. पेशेंट को डायरिया है, थोड़ा फीवर है, डिहाइड्रेशन है. आई वांट टू गिव दिस वेरी फेमस एंटीबायोटिक, मास्टर ऑफ एंटीबायोटिक है ये. किसी को भी लूज मोशन एक बार भी हुआ तो सिफिक्सिम इमीडिएटली शुरू कर देते हैं, सोचते भी नहीं है.
Friends, as we know, all the viral infections, there will be fever. So no need to panic just because child is having fever, maybe whatever the degree is, and he needs antibiotics, not the truth. And the diarrhea, watery diarrhea with fever looks like a viral only. And viral diarrhea treatment is only treatment for the dyselectrolytemia, dehydration, and some management with zinc also. So here, there's no question of antibiotic. As is, see, the ORS is the first choice. Second, zinc is recommended in our area because our soil is deficient in zinc. In the certain areas, this is also not recommended outside India. So the number three, this 2 is correct with viral diarrhea. With the ORS and zinc will be adequate.
Okay, sir, point well taken. So all viral diarrhea, no antibiotic, only ORS and zinc. Dr. Neha, please, they are not score anything, right? So I'm moving ahead this question number 2 to the team penicillin. Are you ready? 7 days old baby neonate brought with complaint of fever one day, taking feed. Patient was febrile, heart rate 160, systemic examination within normal limit. What are the treatment options? Option first, A, paracetamol drops. Option B, amoxicillin drops, paracetamol drops, and refer to pediatrician for the management. And option D, injection ceftriaxone intramuscular on OPD basis for 5 days. Your time starts now.
A, sir, A, paracetamol drops.
Okay, so already the team leaders answer even before timer stops. I am going to our expert, Dr. Mahesh Moite sir. Sir, neonate is 7 days, sir. History proper febrile baby आहे. तर फक्त पॅरासिटामॉल ड्रॉप्स द्यायचे की त्याला पुढे आपण काय करायला पाहिजे त्याला? What म्हणजे what is the possibility in this?
See, this is very critical emergency. 101 fever in a 7 days old baby is a very critical emergency. Okay, this can be anything. This can be sepsis, this can be meningitis, this can be anything. And within 6 hours, this baby may become extremely critical. This patient has to be referred to pediatrician for management. We don't want the general pediatric practitioner. Let me be very clear and honest here, because he will give you very minimal safety window. Within next 2, 4, 6 hours, he will crash. This patient has to be referred to pediatrician for management. I urge, if you are documented 101 fever with systemic, with all those heart rate and all, this is an emergency. This is a specialty, or for that matter, super specialty thing. Don't take chance with this baby. Refer this patient to the pediatrician nearby.
Once documented fever in neonate below one, we call neonate up to 1 month age. So there is always chance of SBI, we call it, a serious bacterial infection. Such patient must be referred to the pediatrician for the further management, right?
So that baby needs complete septic workup.
Yeah, he needs septic workup. Thank you, Rich. Point well taken.
Yes, Dr.
Sir,
Dr. Jay, before you go ahead, Dr. Mahesh Moite sir, for our general practitioners, समर सीझन मध्ये बऱ्याच वेळा न्यूनेट्सला फीवर असतो, तेव्हा पण लगेच पाठवायचा असतो का पॅरासिटामॉल ड्रॉप देऊन बघता येईल, असं काय करता येईल का पेरिफेरी मध्ये? महेश मोहिते
सर, you can screen this baby in this way. Sometimes you wrap the baby and then you feel the fever is there. You document the temperature, which is 99.5, 100, 100.5, whatever. And if you are nearly sure baby is otherwise absolutely all right, you can unwrap the baby, keep in slightly lower temperature place. Again, check the temperature after half an hour. Feel the baby is absolutely stable. Temperature comes back to normal. You can monitor this child. Maybe you review this child again after 2 hours, 4 hours. If the baby is feeding well, taking breast milk well, passing urine well, doing everything fine, no jaundice, nothing, then you can monitor. But generally, I will suggest even that condition. At times, you have seen these babies coming after 2 days with anuria, jaundice, hyperglycemia, shock, renal shutdown, and that's simply because that dehydration fever summer season मध्ये ज्याला आम्ही dehydration fever म्हणतो, that's not a benign entity at all. That also can be catastrophic. So I will give less than 30 days old baby with a documented fever more than 100. It is better you get it screened through a pediatrician rather than treating it as benign. This can very well be a sinister one, and at times we receive the baby where we cannot salvage the baby. So we need to be careful.
Okay.
Yes.
So point well taken. We are moving ahead with the question third to Team Penicillin. Are you ready?
So the answer is refer to pediatrician for management.
Management. Yes. Third question for you, Team Penicillin. Are you ready? Which of the following is a second generation cephalosporin? Options are cefuroxime, ceftazidime, cefalexin, and cefotaxime. Your time starts now.
A. Sir, answer is A. Cefuroxime.
Okay. Point. Yes, we will confirm the answer. Cefuroxime. So your answer is correct. But I request you की तुम्ही समोर बघून answer द्या, वर बघून देऊ नका. There is watching you. They scored Neha Singh. Neha, she scored 10 marks. Ramakant sir,
Yes.
how to discuss these groups? एक minute. Ramakant
Yeah.
sir, his
Yes.
cephalosporin is very commonly used left and right. First generation, second generation, third generation, fourth generation. एवढा विचार करायची गरज काय आपल्याला? म्हणजे आपल्याला एवढे काय कुठला तरी आयटम देऊन टाकायचं सर बिंदास आपला. आपण आपले काय फिवर आता बिंदास सेफिक्झिन देऊन मोकळं करतो. म्हणजे काय काही एवढा फरक आहे का त्या ग्रुपमध्ये? राईट. म्हणजे व्हाय इज फर्स्ट जनरेशन, सेकंड, थर्ड जनरेशन? प्लीज काही क्रॉस गाईडलाईन्स द्या तुम्ही अगदी.
The classification of cephalosporins is according to the spectrum it covers.
Right.
The first generation was having more of a gram positive coverage and no gram negative coverage. The the second generation was having best of both the worlds, gram positive also, but gram negative, but not very effective against gram negative. And in our country, particularly in pediatric age group and neonatal age group, particularly in neonatal age group, gram negative sepsis is a more problem rather than gram positive. And third generation cephalosporins are having some level of gram positive coverage, particularly injectables, but oral third generation cephalosporins like cefixime, which we many times prescribe for tonsillopharyngitis, otitis media, where there is no gram negative organisms are there. In this case, the third generation cephalosporin, particularly oral, have gram negative coverage. So we shouldn't be mixing them and fiddling with them, that when we should use particularly oral first generation gram positive, second generation best of both. So that is usually prescribed by surgeons when they want to give a prophylaxis. And third generation is particularly for gram negative intestinal infection, urinary tract infection. So this way there is the classification, and further fourth generation and fifth generation, according to the their activity against different types of the beta lactamase enzymes, AMPC and all those things, or fifth generation against the more and more resistant organisms, the generation is there. So particularly we have to think into this. We should not be using third generation for gram positive coverage. The gram positive organisms are common in upper respiratory tract infection, otitis media, tonsillopharyngitis, or pneumonia, where this third generation cephalosporins will only be effective. And first generation will be effective most of the time as an anti-staphylococcal, which is not vancomycin methicillin resistant staph. These are organisms are useful, antibiotics are useful against the gram positive coverage.
Okay, thank you.
Dr. Ramakant sir, Dr. Ramakant sir, I am a general practitioner. Cefuroxime acetyl molecule specifically मी कुठल्या कंडिशन मध्ये ऍज अ जनरल प्रॅक्टिशनर मी काय डायग्नोज केल्यावरती वापरायला पाहिजे? Can you name few things, few conditions?
Cefuroxime axial, particularly, there is no definite indication for cefuroxime unless until you are in a surgical conditions, you are going to give or as a step down antibiotic after surgeries. And when some surgeon has used cefuroxime or you have got culture sensitive, but otherwise it will be a first generation cephalosporin in upper respiratory tract or above diaphragm infection. Below diaphragm, this can be made a this thing generalization. This is over generalization. But the gist of today's is that preventing antibiotic resistance. So as far as possible, unless until in OPD, you are sure that this is bacterial infection, infradiaphragmatic third generation oral cephalosporin, supradiaphragmatic first generation cephalosporin.
Thank you. Thank you, Ramakant sir. Ha question choose करण्यासाठी हेच की sir, I have the discussion on the generation of antibiotics. So before choosing antibiotic, we should thought which infection it can be used. So we are moving to the team penicillin. Last question of first round is the question 4 for team penicillin.
Dr. Jay Mohanty sir wants to say something.
No, thank you.
Yes,
See, we should try to desist from using the cephalosporin groups, cephalosporin groups for the common infections. That should come to our mind last. We should not think of cephalosporins.
Mohite sir, huh?
Yeah, just I think giving a very clear message for the general practitioner for a gross differentiation. Infection above diaphragm, usually gram positive. Infection below diaphragm, usually gram negative. So you've got gastroenteritis, bacillary dysentery, you've got urinary tract infection, mainly gram negative. Drug of choice from your point of view, cefixime is reasonably good. Infection above diaphragm, which could be pneumonia, which could be otitis media, which could be tonsillitis. Drug of choice is gram positive. Amoxicillin, sometimes coamoxicillin, that is maybe augmentin. I think this is good enough for you. First, decide whether it is infection. Second, decide whether it is bacterial infection. If it is bacterial infection above diaphragm, use coamoxiclav or amoxicillin. If it is below diaphragm, use cefixime. This should be the way.
सर जास्त डिटेल नका सांगू
पुढे आहे क्विज आहे पुढे.
चला बरं ना क्लू मिळाला ना त्यांना.
Okay, first question for the penicillin.
You get stimulated to talk more and more.
The idea is to give the knowledge, right? Idea is to get the knowledge.
That was at the last, sir.
Okay.
For the penicillin.
Yes.
A 2-year-old boy brought with complaint of high-grade fever, cold since 2 days, was febrile with temperature 103 degree Fahrenheit, throat congested, stitching examination within normal limit, investigation showing total counts 12,500, neutrophil 70%, leukocyte 28%, eosinophil 1%, basophil 1%, CRP 16 milligram, and child is active during a febrile period. The treatment options are A, syrup amoxicillin, syrup paracetamol. Option B, syrup paracetamol, decongestant syrup, normal saline nasal drop. Third option, syrup azithromycin and syrup Ivosic plus. And the fourth option is syrup Meftal and syrup Cefalexin. Your time starts now.
Paracetamol and
समोर बघा.
A, sir, A.
Okay. So they are chosen. Dr. Hemant, please computer confirm answer क्या है? Confirm करा. Okay. Answer is syrup paracetamol decongestant syrup. Yes. मोहिते सर, या पेशंटला 103 ताप आहे, पण मी तर फक्त पॅरासिटामॉल डिकंजेशन नॉर्मल सलाईन देऊन त्याला परत पाठवतोय. आता म्हणजे काय असेल याच्या पेशंट मध्ये की त्याला अँटीबायोटिकची गरजच वाटत नाही आपल्याला.
Look at the history. Look at the presentation. High-grade fever right from day 1, day 2. But in between fever, the child is active. When there is no fever, child is active, which is a marker again of a viral infection. If it is bacterial infection, child will not become active in between. That is first. Second, he has got throat congested, fever, then some cold. So multiple sites are affected, again suggestive of viral infection. So this is a very kind of classical in an epidemic period, right? सर्दी येते, खोकला येते, नाक गळते, डोळे चुरचुरतायत, अंग दुखतंय, डोकं दुखतंय, multiple system presentation, that is viral. High grade fever can be there in local bacterial or viral infection, but there is quick response to paracetamol, that is again marker of viral. And in between fever, child is comfortable, active, that is also viral. So this is viral infection unless proved otherwise. Now CRP, somebody said it is 16. CRP is absolutely non-specific. डेंगू मध्ये पण CRP वर जातो, बॅक्टेरियल मध्ये जातो, व्हायरस मध्ये जातो, फंगस मध्ये जातो, किंवा काही नसलं तरी जातो. So don't go by CRP. First of all, don't do CRP only in first 2-3 days. For that matter, I wonder why CBC was done within first 2 days for this child. आमच्याकडे कधी कधी पेशंट 5व्या दिवशी येतो आणि त्यापर्यंत त्याचे 4 CBC झालेले असतात. ऍक्च्युली काही रोलच नाहीये. तुमच्याकडे क्लिअर इंडिकेशन असेल तरच, लाईक डेफिनेट हाय ग्रेड फिवर आहे पण कुठेही फोकस नाहीये तापाच्या 2ऱ्या-3ऱ्या दिवशी, तर CBC युरिन करा, नाहीतर करू नका. Ideally, ह्या मल्टी सिस्टीमने वेट फॉर 3 days. After 3 or 4 days, if the fever is not subsiding, then you do CBC CRP. So the whole problem started because you did a CBC on day 2 and a mismanagement. So this is classical virus. We should be given only paracetamol, decongestion, nasal drops, nothing else.
Okay, thank you, sir.
मोहिते सर, ऍज अ जनरल प्रॅक्टिशनर मला हे सांगा, मी CRP केव्हा करायचं, CRP कुठल्या व्हॅल्यूला सिग्निफिकन्स द्यायचं, आणि कोविड इरामध्ये तर CRP पॉझिटिव्ह लागेल मी लगेच कोविड टेस्ट करायचं, आता करायची की नाही करायची?
आम्ही कोविड मध्ये पण तर CRP करत नव्हतो, कारण ते व्हायरसच होतं, पहिली गोष्ट. ओके, कोविड मध्ये काही स्पेसिफिक इंडिकेशन्स होत्या, त्यामध्ये अदरवाइज CRP वॉज नॉट अवेलेबल. CRP हे काय आहे म्हणजे 3 टेस्ट आता अवेलेबल, ESR, CRP आणि प्रोकॅल्सिटोनिन. आणि सगळ्या गरीब माणसांसाठी ESR, थोड्याशा श्रीमंतांसाठी CRP आणि अति श्रीमंतांसाठी प्रोकॅल्सिटोनिन, असं आमच्याकडे विनोदाने म्हटलं जातं. आणि ते बऱ्याच अंशी खरं आहे, कारण ESR हे तिन्ही ज्याला आम्ही अॅक्यूट फेज रिॲक्टंट म्हणतो, म्हणजे शरीरात कुठेही इन्फ्लमेशन झालं, इन्फेक्शन नव्हे. आपल्यापैकी बऱ्याच लोकांना माहिती असेल, एखादा बॅक्टेरिया, व्हायरस किंवा काय झालं किंवा कुठे मार लागला, बर्न झालं, कशाने सुद्धा बॉडीची पहिली रिस्पॉन्स असते इन्फ्लमेशन. इन्फ्लमेशन म्हणजे त्या ठिकाणी गरम होणं, सूज येणं, रक्तप्रवाह तिथे वाढणं, दुखणं, याला आपण इन्फ्लमेशन म्हणतो. तर ते इन्फेक्शनमुळे होऊ शकतं किंवा नॉन इन्फेक्शन मध्ये सुद्धा होऊ शकतं. आणि इन्फ्लमेशन झालं की त्याला बॉडी रेस्पॉन्स ESR वाढणं, CRP वाढणं, कित्येक केसेसमध्ये प्रोकॅल्सिटोनिन वाढणं. त्याचा अर्थ CRP म्हणजे इन्फेक्शन नव्हे, CRP म्हणजे फक्त इन्फ्लमेशन. ते इन्फेक्शनमुळेच असं नाहीये. त्यामुळे प्रचलित भाषेत तुम्ही जसं म्हणता की CRP वाढलं त्याला अँटीबायोटिक द्या, हे ताप आला की अँटीबायोटिक द्या सारखं झालं. सो डोंट रिलाय ऑन CRP. मग कुठल्या पेशंटमध्ये करायचं? ऑनेस्टली CRP वर बेस्ड खूप कमी आजार आहेत जे आमच्या क्लिनिकल प्रॅक्टिसमध्ये आहेत. मग CRP कधी करतो? एखाद्या बाळाचं अॅक्यूट इन्फेक्शन मध्ये खूप वाढलं असेल तर कधी कधी नंतर मॉनिटरिंग करण्यासाठी, किंवा आता CRP कमी होत चालले म्हणजे बहुधा पेशंट आता रिकवर होत चाललाय. त्यामुळे CRP ने डायग्नोसिस होत नाही. CRP ने फक्त इन्फ्लमेटरी स्टेटस इम्प्रूव्ह होतंय की डिटेरियोरेट होतंय एवढं आपल्याला कळतं. So CRP is not diagnostic of any clinical condition. That is what I would say.
Thank you. So we're coming to the end of round 1 for team penicillin. Neha, how much they have scored?
At the end of round 1, team penicillin has scored 10 points.
Okay, thank you, Neha. So moving on to the team Ciprofloxacin. Are you ready? Acknowledge team.
Yes, sir.
Yes. Who is the team leader?
मयूर कल्याणी.
मयूर, मी तुझ्याकडे बघणार, तू लोकांना डिस्कस करा. आदर सर, प्लीज म्यूट युअर व्हिडिओ पण ऑफ केला तरी चालेल, म्हणजे अजून बरं पडेल. म्हणजे बाकी सगळे मयूर, आय एम लुकिंग ॲट यू. यू कॅन डिस्कस अँड rules are you know better, right?
Yes, sir.
So is the first question on the screen for you.
Dr. Jay, all members of West Raigad seen and this
सगळे members आहेत वेस्ट रायगड.
वेस्ट रायगड नी सर्वांनी व्हिडिओ ऑन करायचं आणि
Video on करा.
बाकी ऑफ करायचं.
बाकी व्हिडिओ ऑफ करा प्लीज.
Except experts, Dr. Neha, Dr. Jay, myself, all videos will be off. And Dr. Ramakant sir, video on, please.
मयूर, तुमची टीम लीडर, टीम कोण कोण आहे? टीम नाव घ्या तुम्ही पटापट प्रत्येकाशी.
तर रवी म्हात्रे सर आहेत, ओमकार आहे आणि अमित
Video
आहे.
ऑन करा, व्हिडिओ ऑन करा,
व्हिडिओ ऑन करा प्लीज. सगळ्यांनी व्हिडिओ ऑन करा.
Dr. Neha, as I am not able to see all the, please just see all 4 are there or not.
Dr. Ravindra, please put on your camera.
Team participating should put their camera on. We don't want their video off. Dr. Neha, please take it.
Dr. Ravindra, please. Yes.
Yes.
Dr.
Yes, sir.
Ravindra, Dr. Mayur, Dr. Omkar, and Dr. Amit.
Yes, sir. Start now.
All four are there?
Yes, sir.
Yes, sir.
Yes, Jay, please.
Okay, there's a question first on the screen for you, Team Cephalosporin. A 6-year-old boy brought with couple of ear pain, cold and cough since 2 days. Treatment options are A. Syrup paracetamol decongestant follow after 3 days. B. Syrup amoxicillin 100 mg per kg per day for 10 days and syrup ibuprofen. Option C. Syrup cefixime, syrup ibuprofen. And option D. Syrup amoxiclav 90 to 100 mg per kg per day and syrup paracetamol. Your time starts now.
सर आपलं आन्सर ए देऊ मला ए वाटतं सर ए ला लॉक करा सर.
Okay, so captain has answered the answer A. आम्ही लॉक केलेला आहे तर आमचा कॉम्प्युटर रिव्हील करेल. Yes. Okay, so perfectly right. You have scored 10 marks. Please, yeah. मग आन्सर 6-year-old बॉय आहे, इयर पेन, त्याला अँटीबायोटिकची गरज आहे, लगेच जायला पाहिजे त्याला अँटीबायोटिक. एवढा त्याला पेन होते तर त्याला परफोरेशन होऊ शकतं ना त्याला इयर ड्रम मध्ये.
मला विचारलंय का भांडारकर सर?
मला विचारलंय सर. हा.
I first of all I congratulate the team Cephalosporin for wonderful answer, and it requires lot of courage. What are the indications of antibiotic in otitis media? So this is very important. This is only 2 days boy. So 2 days fever with earache. Everybody must have their otoscope in their clinic. As pulse oximeter is not an instrument, it is like stethoscope has become an additional instrument in clinical examination. Similarly, otoscope will also become a clinical examination part and not an instrument. And we all know in all many viral infections, there is definitely myringal infection is there, tympanic membrane inflammation is there. And these patients have earache. So there is a definite protocol. Antibiotic with tympanic membrane congestion below 1 year, we give antibiotic. If patient has received antibiotic in last 1 month or amoxicillin, in this case, or there is, then we use amoxiclav. And patient who has received these and having less than 1 year or 6 months, who has received amoxicillin, then in that case or amoxiclav, you can step up the amoxicillin to 80 milligram. But it has been known that in our country, still the Diplococcus pneumoniae, which causes otitis media, still are not very resistant to amoxicillin to give very high dose amoxicillin. So very nice answer. Ear pain, cold does not mean it is a purulent or acute otitis media. Definitely otoscopy will tell you whether there is a collection behind the tympanic membrane, whether the bulge is there or not, tympanic membrane movement is there or not, and whether you are seeing only middle ear effusion. In that case, it is better to give decongestant and analgesic, particularly only paracetamol, and you have to follow this child. And 95% times you will not be needing to give antibiotic. Only in 5% times, after 48 hours, you may need amoxicillin and not even amoxiclav.
Okay. So point well done. So many times.
Ramakant sir.
एक मिनिट गंगुले सर.
रमाकांत सर, ऍज अ जनरल प्रॅक्टिस ओटोस्कोप आहे आमच्याकडे, पण जर वॅक्स असेल तर कसं काय करायचं?
So in every patient, you have to remove the wax. It is impacted wax is very, very uncommon, particularly in pediatric patients. So removal of wax is important. Still, clinical condition tells you that below 1 year, then you are justified in giving antibiotics. Above 1 year, you have to try at least 24-48 hours and see for the increasing pain, irritability, then you may give antibiotics, even if you are not able to see the tympanic membrane by otoscope.
Okay, sir. Point well taken. Many times the pain in ear during cough and cold is a eustachian blockade, so antibiotic is not needed. So moving on to the question number 2 for the team cephalosporin. A 7-year-old boy brought in the OPD clinic with complaint of fever, throat pain, and vomiting. Patient was given injection ceftriaxone intramuscular. Patient started complaint of uneasiness, itching all over body, weakness, tachypnea, tachycardia, sinus was there. What are the treatment options? Option A, injection adrenaline, oxygen, stabilize the patient and shift. Option 2, injection IV fluids. Option C, injection hydrocortisone IV fluids. Option D, no treatment given. Ask relative to take the patient to nearby hospital immediately. Your time starts now.
Mayur, it's option E, adrenaline, oxygen and stabilization. Mayur,
सर डी देऊ का आन्सर दादा?
no, Mayur, it's option A. Adrenaline, he has sinuses, so it needs oxygen. Option A.
सर आन्सर इज ए.
ओके, आता ही इज अ करेक्ट डिस्कशन आणि तुम्ही टायमर ऑफ होण्याच्या पूर्वी तुम्ही बोलल्यामुळे वी आर लॉकिंग द अवर योर आन्सर ऑप्शन ए, इंजेक्शन एड्रेनलिन, ऑक्सीजन, स्टेबलाइजर, शिफ्ट. यस, कंप्यूटर जी बताइए क्या है इनका आंसर. ओके, सो कॉन्ग्रेचुलेशन, योर आंसर इज करेक्ट. नेहा,
थँक्यू अमित.
जी तिथे रुटीन ओपीडी, तिथे ऍडनालिन कुठून आलं, ऑक्सिजन कुठून आलं, पेशंटला स्टॅबिलाइज करणार आय फ्लुइड कुठं आलं, तिथं अपोव्याक्टर असेल का, ऑक्सिजन सिलेंडर. तर समजा हा पेशंटला काही झालं असतं, आपल्याकडे ऑक्सिजन नाहीये, इंजेक्शन ऍडनालिन नाहीये, तर मेडिकल लिगल केस होऊ शकते का त्या डॉक्टरांवर? राईट.
मला विचारलंय,
तुम्हाला विचारतोय मी, मेडिकल लिगल एक्सपर्ट.
क्लिअर. आता आपला दिस इज द इरा ऑफ कंझ्युमरिझम आणि मेडिकल लिगली प्रत्येक ओपीडी मध्ये इमर्जन्सी मेडिकेशन्स, अंबू बॅग, लॅरिंगोस्कोप, ऑक्सिजन सिलेंडर हे असणं आवश्यक आहे. द रिझन आय विल टेल यू, हे असणं आवश्यक आहे. आता ते किती चालतं नाही चालतं, किती येतात नाही येतं, ते दॅट इज डिफरंट. बट द थिंग इज दॅट इफ एनिथिंग दिस हॅपन्स, when you do all the resuscitation measures in proper way and you document all the things, in spite of that, if death occurs, this is not. पण तुमच्या ओपीडी मध्ये ह्या वस्तू काहीच नाहीये आणि तुम्ही मग कसं दाखवणार की मी अटेम्प्ट केलं रिससिटेशन मेजर्स? when you cannot show that this resuscitation was not done, then it is known, it is a gross negligence. That is absolutely medical legal prima facie negligence for that. So the take home message is always, because and moreover I will just, because there is a lot of use of injections in general practice and more often we use injection diclofenac, and we have seen lot of reaction in diclofenac in our area, in our neural area also. I have seen the reactions to diclofenac sodium, and we have famous case from Pune where diclofenac was given and there was a lot of cure. So as general practice they do injection, but I will just advise, please use judicious injections, and if you are using it, if anything happens, if any anaphylactic reaction occurs, one should know the protocol, how to go about. Of course adrenaline is the first choice. Again adrenaline काय होतं हे जाण्यात आपण सर्च करतो. द वर्ड इज adrenaline should be in a reach of a hand, आणि त्यासाठी पाहिजे तर तुम्ही एकही करू शकता. प्लीज माझा एक कर, म्हणजे कधी पण टेकूमवर एक स्लाइड असते, adrenaline a day is always advisable. आपण सिरिंज भरून ठेवू शकतो, and that adrenaline really helps and it should be at the reach of the hand, आपल्या जवळ पाहिजे. आणि दुसरी, adrenaline has a very short expiry, so we should always check the expiry dates of all the medicine. That is very important. adrenaline जास्त कॉस्टली नसतं, we should be kept.
थँक्यू हेमंत गंगोलेजी.
डोस वगैरे काही सांगत नाही मी, कारण मध्ये पुढे आहे तर त्याच्यामध्ये नाही काही.
जस्ट फॉर द सेन्सिटायझेशन ऑल ऑफ यू की आपल्या इव्हन हॉस्पिटल असू दे किंवा ओपीडी असू दे, तर ऑक्सिजन, ऍड्रेनालिन आणि थोडं रिसर्चेशन किट जे बेसिक आहे, यू मस्ट बी देअर टू, not for only to avoid the medical legal, rather to save our patient. Thank you very much. Moving on to the third question.
अजून एक ऍड कर, बिकॉज दिस इज अ जनरल प्रॅक्टिस वर देअर. जस्ट मला बघता येत नाही, पण just assess yourself. How many of you have these all things in your OPD clinic? That is very important. आणि समजा कधी अशी घटना घडू नये, पण जर झालं घटना तर जे काय तुम्ही हे डिसिजन करणार, प्लीज केप ऑल द थिंग्स ॲज इट इज. कारण ह्याच्यामध्ये कधी कधी आपल्याला पोलिसला इन्फॉर्म करावं लागतं, आणि जेव्हा ते येतात दे डू द पंचनामा. इन पंचनामा ऑल थिंग्स शुड बी सीन देअर, की ह्या पद्धतीने हे गोष्टी वापरले गेले. त्याच्यामध्ये सिरिंज कलेक्ट करतात, युज वायर्स कलेक्ट करतात, पण माइंड वेल की ते युज वायर्स मध्ये एक्सपायरी वाला डेट वाला व्हायला नाही पाहिजे, अदर इट कॉज अगेन ट्रबल. सो दिस ऑल थिंग्स वी शुड बी सेन्सिटिव्ह अबाउट दॅट. आणि हे सर्व पंचनामा केल्यानंतर आपलं वी शुड क्लीन अप द थिंग्स, अदरवाइज शुड नॉट क्लीन अप द थिंग्स. दॅट वॉज अ पीस ऑफ ॲडवाइस.
Okay, thank you. Moving with the third question for the team cephalosporin. Computer जी आने दीजिए third question. Is a picture. What is the diagnosis, drug dose, and the duration of that drug dose or drug? The time starts now.
It's a follicular tonsillitis. Drug is amoxicillin, and the dose is 40 to 50 mg per kg, and duration for 7 days.
Okay, Mohite sir, should we take this correct? Diagnosis is correct?
Most of the part he gave is right, except the duration is 10 days.
Okay.
Otherwise, answer is right.
Still we give it to you because diagnosis is correct and around 7 to 10 days is the correct treatment.
It should be given to him.
Okay.
Yeah, it should be given. It should be.
So 33 चौकार मारला त्यांनी. Congratulations team. As per the student, we are moving ahead to the third question, fourth question for them. 10-year-old boy brought with complaint of fever since 5 to 6 days, decreased appetite. On examination was febrile, toxic, vital stables, cyst examination, liver palpable, spleen just palpable, and rest systems are within normal limit. Also suspected enteric fever maybe. How do the treatment options are? First, tablet cefixime, syrup paracetamol. Option B, IV ceftriaxone on OPD basis, not respond treatment and investigation sent. Option C, investigation sent including blood culture and tablet cefixime started and call for follow-up. And option D, tablet Larion, tablet cefixime both started. Your time starts now.
तर बी बोलू, बी वाटते का? रवी मात्रे सर.
Time is going, please respond.
Sir, our answer is B.
Okay, B for Bombay.
Yes sir.
Okay, so computer जी जरा आन्सर रिव्हील करा काय आहे. Actually, answer is investigation and including blood culture and then tablet cefixime or antibiotic started and follow up. मोहिते सर, हे उत्तर कॉम्प्युटरचं बरोबर आहे का?
अगदी बरोबर आहे. फक्त हे किती ठिकाणी प्रॅक्टिकल आहे हे आपण विचार करायला हवं.
राईट.
उत्तर ऍब्सोल्युटली स्टँडर्ड ऑफ केअर आहे, पण हे किती ठिकाणी प्रॅक्टिकल आहे का? फॉर द जनरल प्रॅक्टिशनर्स वी मस्ट नो, though the clinical diagnosis is enteric, as per today's guidelines, related whether it is TB or whether it is typhoid, whether it is malaria, there are clear guidelines that we should prove that infection, because once you prove it, you can give the complete course of treatment. So ideally, we should send a blood culture, and you have a strong suspect of enteric, then you start the antibiotic, which can be oral cefixime, or if you are hospitalizing, then you can be giving IV ceftriaxone. That is how you will be doing it. So send a blood culture and then start the antibiotic. That is the way it should be.
Okay. So not scored this time. So Neha, what is the final score for them?
So team cephalosporin has answered 3 questions right, and at the end of round 1, they have scored 30 points.
Okay, congratulations team. So we are moving with the team macrolide. Are you ready?
Thank you sir.
Team macrolide, team leader.
Yes sir, we are ready sir.
तुमचे टीम बाकीचे आहेत का बघा, आलेत का?
टीम आहेत ना?
नावं घ्या ना. नावं घ्या.
डॉक्टर सत्या ठाकरे, डॉक्टर तुषार, डॉक्टर अनिल, डॉक्टर सचिन, डॉक्टर नेहा, प्लीज.
Yes sir. Yes sir.
Yes sir, we are there.
Yes sir, we are present.
व्हिडिओ ऑन करा. व्हिडिओ प्लीज ऑन करा.
On all video of all.
सचिन,
Put on your camera.
कॅमेरा ऑन करा प्लीज. हा.
Dr. Tushar.
प्लीज पटपट करा, आपल्याला वेळ होतोय. Okay, sir,
They-
here the
Yes,
question
we-
1 for the team macrolide on the screen. 9-year-old patient brought with complaint of fever since 5 days, rash over the body, pain in abdomen, weakness. Patient's febrile, macrobapar rash was there, tachycardia, cyst examination within normal limit, investigation, dengue test was positive IgG. What are the treatment options? First, syrup paracetamol, syrup Meptal spas. Option B, tablet Cipodem, syrup Meptal P, syrup papaya juice. And third is injection Ciplox, IV fluids on OPD basis. And option D, refer to hospital for the further treatment. Your time starts now.
It's option A.
Video on करा.
No,
सत्याजी
sir.
video ऑन करा तुमचा.
On झालाय.
नाही पण ठीक आहे. Answer टायमिंग संपतंय.
Option A. Syrup paracetamol. Syrup Meptal spas.
No. It's a D. It's a D.
नाही ओके टाइमर पण संपलेला आहे. Time is off already. So which is the answer please? Putraji, please reveal the answer.
It's a D. D. Refer to hospital for treatment.
नाही तुमचा टायमर you cannot change the answer. जे तुम्ही दिलं पहिलं A तेच असणार आहे confirm.
And Dr. Jay, before you ask the expert, please, your team and you just make your video on, as well as you discuss first and give the final answer within the time frame. Please, yes, Jay, you can ask the expert.
Okay. Yes. मला तुझा answer सांगा काय आहे?
Refer to hospital.
ओके. मोहिते सर, हा जो पेशंट आहे डेंग्यू आणि व्हॉट आर हे काय बघायचं म्हणजे त्याला पेन आहे, ॲब्डोमेन विकनेस आहे पेशंट, हा पेशंट ओपीडी विसर ट्रीट करायला का इमिजिएट हॉस्पिटलला पाठवलं पाहिजे? व्हॉट आर द का रेफर करायचा?
See, look at his presentation. He's already on day 5 of fever. He has got abdominal pain. In a suspected case of dengue, abdominal pain is the early marker of shock. Then he is having weakness, which is again a marker of shock. Okay, tachycardia. So all the clinical features of shock are already there. So he's already getting into shock. This patient, even if you waste another 12 hours, he will crash. The dengue IgG is no more a standard of care. You should do NS1, IgG, IgM, all three, which can give you a marker more detail. But his clinical presentation is clearly of a sick child. Forget whether it is dengue or not.
Yes.
His clinical presentation is of a very sick child. He's got weakness and abdominal pain, and this could be a marker of early decompensation, that is shock, and with that tachycardia. So don't waste time. This is not paracetamol. This is not antibiotic. This is, he will require IV resuscitation quickly to salvage him. So he has to be referred to the hospital.
Okay, sir. Point well taken.
Yes, Dr. Jay, just for general practitioner, Saranji said borobar, but if IgG positive असेल, it is almost secondary dengue, and you should be very careful from day 4 to day 7 or day 8 of the fever, and you should be very careful, monitor, and best thing is refer to hospital if these things is there.
Okay.
Yes.
Other Hemant Gongre sir, take home message from myself, from Fees Master. See the clinical picture, physiological status of the patient. Enteric है, dengue है, UTI है, meningitis loss. Patient is critical, going in the shock. We must refer to the hospital immediately. So they are not scored exams. Are you Dr. Satya? Please video on kara, concentrate kara.
Sir, my video is on, but sir, video on आहे sir माझा.
हो बंद झाला होता मध्ये. आता टाइमवर लक्ष ठेवा, तुम्ही डिस्कस करा, तुम्ही उत्तर द्यायचंय. हा टीम.
सर मी डी बोललेलो सर ऑलरेडी. इट्स
नाही बघा ते लक्ष द्या तुम्ही. आता क्वेश्चन 2 ऑन द 1 month old patient brought with complaint of fever for 2 days. Convergence twice. There's a generalized tonic-clonic convergence 15 minutes back. But on examination, patient was afebrile, vital stable. What are the treatment options? Option A, syrup cefotaxime with paracetamol drops. Injection ceftriaxone, paracetamol drops. C, refer to the pediatrician. Option D, syrup Gardinal, syrup calcium and paracetamol drops. Your time starts now.
Hello team. I think it's a C, refer to pediatrician. What you all suggest? It's a, in
Yes.
my opinion, it's a C
Yes,
refer to
yes,
pediatrician.
Yes,
yes,
agree.
agreed. Yes, agreed.
Okay.
Yeah.
Refer to pediatrician.
Okay.
Yes, sir. Answer is C. Please lock the C.
Why?
Because the patient is only 1 month old. Old patient is there, sir. He's having fever of 2 days, and he's having the convulsions twice in 15 minutes.
ठीक आहे. Okay. So point well taken. So we log the answer बघा काय आहे. Question. Okay, your point well taken. Patient refer to the pediatrician. रमाकांत सर, काय पेशंट मी बघितलं पेशंट अफेब्राईल आहे, स्टेबल आहे सध्या, म्हणजे जेव्हा एक्झामिनेशन आला तेव्हा स्टेबल आहे त्याला.
But sir, in 15 minutes he has twice of in
Expert
15 minutes
now.
time is twice.
हॅलो सत्याजी, आपले एक्सपर्ट एक्सप्लेन करतील आपल्याला.
Okay, sir. No problem. Thank you.
Congratulate the team for giving an excellent answer. That this is how do we classify fever? We classify fever in age group wise below 2 months, 2 months to 5 years, 3 years, 36 months, and 36 months, because here the organisms are different. Usually fever in cases of fever without focus. Now this has not remained fever without focus. Even if patient has come now afebrile, but there is a definite history of fever, and as Dr. Mahesh Mohite has said, the fever in neonate to 1 month or 2 months has to be taken very seriously. Now this fever is localizing to CNS condition, and we previously used to say that early neonatal septicemia but late neonatal septicemia, but now that classification has gone. Still, this is a patient of neonate having fever with convulsions. So any neonate with fever, may there be convulsions or no convulsions, and which is for 2 days. That means it was definitely documented for 2 days. So this has to be taken seriously, and investigations should be done, and patient should be under the care of neonatologist or pediatrician for further evaluation and management. And we will not go into nitty-gritty of whatever the treatment, but the correct answer is like this. And why? Below 1 month, there are definitely it is the fever, and that too documented for 2 days. And additional, as said by Dr. Satya, there is definitely convulsion. So this is localizing to CNS. So this patient has the definite suspicion of bacterial infection. Pyogenic meningitis is suspected. So we refer this patient to pediatrician.
Okay, point well taken. Move on the question 3 for the team macro lead. जरा पटपट जाऊयात आपण आता. This is the throat examination of the patient come to your OPD. What is the diagnosis or the treatment? Dr. Satya, your time starts now.
What do you think, Tim?
It looks like viral pharyngitis, gargles, and paracetamol, plain paracetamol. Wait and watch for 2 days.
So timing संपलेलं आहे. So
जय भाई, टाइम जस्ट एंड व्हायच्या अगोदर सुरू झालं होतं बोलणं त्यांचं.
ठीक आहे, त्यांचं डायग्नोसिस त्यांनी आन्सर दिलंय व्हायरल फॅरेंजायटिस, आणि ऍक्च्युली दिस इज अ नॉर्मल थ्रोट. नो ट्रीटमेंट. So we have the fourth question for the team. चौथा प्रश्न.
Just any of the expert, why do we say it's normal throat? And then lal diste asar. Why do you say?
First of all, maybe the question to be asked by the panelist is, we don't examine first, we take the history first.
Yes.
To tell me the history. Okay, we should have asked her, make it a habit. Whoever big boss it may be, tell me what is the problem. पहिला पेशंट आल्यानंतर तोंड उघडा म्हणता का? काय होतंय तुला? साहेब काय नाही होत, पण ठीक आहे तोंडच उघडू नकोस, जा घरी. Understand? So ask this. So this is a kind of a tricky question which Jay has asked. So this is just to tell the general practitioners that take the history first, then go for clinical examination, then make your diagnosis with or without your lab, and then finally write the prescription. Okay, so go through that channel. Don't examine directly. That's what we want to convey here.
Fourth question for team macro lead. 6-month-old baby brought with Isham cough, mild fever since 5 days, and on examination, child was mildly febrile, vitals normal, respiratory system bilateral rhonchi. What are the treatment options? A. Syrup augmentin, paracetamol drops, nebulization. Option B. Nebulization, hypotonic saline or salbutamol with normal saline nasal drops and paracetamol drops. B. Betamethasone drops, nebulization and paracetamol SOS. D. Cefixic drops and nebulization, paracetamol drops. Your time starts now.
It seems B. So mild fever is there.
Satya sir, A, option A.
Time is over. No answer given by the team.
ठीक आहे नाही, देऊ दे आन्सर देऊ दे.
Answer पटकन द्या सत्या सर.
पटकन द्या, एक
It's
सेकंड.
A.
So we are locking the answer A for them. Computer जी काय आंसर मला सांगता जरा.
B side.
ओके. मोहंती सर जी ये बताइए, ये तो बेबी को 6 month फीवर है, 6 बेबी है, तो फीवर है तो इन्होंने ऑगमेंटिन चूज किया था उनके लिए. अभी तो जो सीजन चालू था 1 month पहले, तो बायलेटरल रोंका है तो बेबी को उसको एंटीबायोटिक की जरूरत है कि नहीं है सर? सर अनम्यूट कीजिए सर, अनम्यूट.
There is no need of antibiotics. The augmentin paracetamol drop is not required. Hypotonic saline and salbutamol nasal drops, it's adequate.
Okay, so point well taken. Bilateral usually chest signs असेल तर immediately pediatric मध्ये this is viral infections. So time is quite less आता. वाटतं आपण पुढे जाऊयात. So thank you very much team back to lead. How much they have scored, Neha?
Team Macrolide at the end of round 1 has scored 10.
Okay. So moving with the next team, Team Philonon, are you ready? Team leader. Team leader कोण आहेत?
Dr. Neha, please check the videos. Dr. Siddesh, Dr.
Who is team leader?
Yes, Dr. Siddesh and Dr. Sunil.
Siddesh हात वर करा.
Yes.
Okay, मी तुमच्याकडे बघणार. हां. So
What more are there, Dr. Neha?
Okay. हे चालू आहे का? गुगल आवाज येतोय. हां? ईस्ट रायगड कोण आहे? ईस्ट रायगड.
हॅलो सर.
ओके.
बाकी लोकांनी व्हिडिओ बंद करा. प्लीज
Yes, four sir participants.
आवाज आहे.
Please put on your
प्रवीण का साउंड इफेक्ट आ रहा है वहां से सर.
and Dr. Sunil.
Okay, chalo.
Yes, ma'am.
Question first for the team Philonon. 3-year-old brought with complaint of pain in abdomen, burning micturition, straining during defecation, and what are the treatment options for her? A. Syrup cetal, syrup paracetamol. B. Investigation, send urine microscopy, culture, start cefixic, laxative, paracetamol, and follow up. Option C. Syrup IVC plus, syrup dicyclomine. D. Injection gentamicin, intramuscular syrup paracetamol. Your time starts now.
सर पोरा सर बी. हा म्यूट आहे तुमचा आवाज म्यूट आहे.
हा बी बरोबर आहे.
बी 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 बी
B for Bombay.
Yes, sir.
Leader असं हात वरून सांगा आमचं B असं मोठ्याने. हा. We are locking the B answer for them. Computer जी.
व्हिडिओ ऑन करा. सुनील व्हिडिओ ऑन करा. तुमचा व्हिडिओ ऑफ आहे. व्हिडिओ ऑन करा.
अहो सर मी ट्रॅव्हलिंग मध्ये आहे, त्याच्यामुळे व्हिडिओ नाही ऑन करू शकत नाही. व्हिडिओ नाही.
ठीक आहे.
ओके सर, थँक्यू.
Okay. Congratulations, answer. Yes. So, this is the most maybe case of UTI on the clinical examination or on the answer point well taken. In urine microscopy culture, then start cefixic. And very important. मोहिते सर आहेत का? मोहिते सर, हे कॉन्स्टिपेशन इम्पॉर्टंट आहे का हो UTI मध्ये?
व्हेरी इम्पॉर्टंट आहे. constipation usually causes blockage of the urethral passage, and that can cause stagnation. Hence, that leads to recurrent or persistent kind of a infection. So UTI, rather recurrent UTI, common cause is constipation. Okay, so relieving that constipation and subsequently making the child void more frequently even after the recovery of infection is something which need to be advised to. So plenty of water, recurrent voiding, avoiding constipation is very important, apart from culture, as he has already said, which will tell you which bacteria are there. In case your primary self-enzyme don't work at the end of 3-4 days, you have a culture report to suggest which antibiotic will work, right? So go always first routine urine that shows percent, send a culture, start your antibiotic, and meanwhile take care of constipation. That is your complete treatment.
Scored 10 marks. Congratulations. We're moving on to question 2 for Team Kilolons. About the varicella infection, which of the following is the correct? A. Diagnosis is usually made by fluorescence from the fluid within the vesicle. Thrombocytoma is a key feature. Varicella is readily diagnosed on the clinical ground. Varicella virus is completely eradicated from the body after infection. Your time starts now.
Sir, Siddesh sir, C.
C. Yes. C.
Yes, sir.
Captain. Captain G.
C.
Okay, Captain C lock करायचा आहे. Okay, computer G, please. Okay, point to be taken. Your answer is perfectly right. Varicella is the readily diagnosed on clinical ground. I had with the third question for the team Kilolo.
Doctor, background noise from your side. Please switch off your fan. Lot of background noise is there.
त्यांना म्यूट केलंय का बाकीच्यांना आता गेला आवाज ओके सो इज द क्वेश्चन थर्ड with regards to seasonal influenza which of the following population has a risk of their influenza episode being complete with A. Neurocognitive disease, B. Chronic steroid use, C. Obesity, D. Any chronic lung disease. Your time starts now.
B, sir. Chronic steroid use.
D. Chronic lung disease.
Okay.
Many patients have more chances of developing pneumonia.
Captain, timing.
Steroid use, I think.
So answer
D.
Captain.
D.
Lung disease.
Yes.
D ना?
Yes.
क्या बनता है?
D.
D for donkey.
Donkey, yes.
हाँ, okay.
Dombili fever.
Okay, चला computer जी answer द्या. Perfectly right. There scored 10 mark. Congratulations. Question 4. About the 6 killer diseases in the childhood before in the immunization, which of the following is the one of these? First is a bronchial asthma, second pertussis, third herpes simplex, traumatic brain injury.
B.
Time starts now.
Sir, B. Second, B. Pertussis.
B.
Pertussis सांगा ना असा व्यवस्थित.
B वाटते का सर पोरवा सर?
हो चालेल सर.
हा B बरोबर आहे.
B.
Captain सांगतच नाहीये.
Yes, मेहता सर. B. Bombay.
Okay, we're locking the answer B for you. Perfectly right.
Right.
Congratulations.
Great, sir.
We're not discussing. आपण नंतर करू आता पुढची आपला राउंड फर्स्ट पूर्ण करू. Yes. What is the final score for them? What is their scores?
Team Cunilons have answered all the questions correctly. They have scored 40.
Congratulations. Okay, we're moving the team Beta Lactam. Are you ready?
Yes.
Captain कोण आहेत? Who is going to answer? Answer कोण करणार आहे? हा?
या मी.
तर तुम्ही मी तुमचा आन्सर पकडणार, तुम्ही मला सांगायचं. टायमर करता. तर your question first for you on the dais.
Dr. Neha, please check the mentor is not there. Dr. Sunil Seth is not there, na?
इकडे आपण हात आहे मागे समोर. I'm there.
Answer सांगू नका.
Question first.
सुनील मागे उभा राहा, तुझ्या हातात बोर्ड आहे आम्हाला दिसतोय.
आता मागे बरोबर आहे. राईट.
Question first, please, on the dais for beta lactam. Which statement is incorrect about the effective antibiotics? Show selective toxicity, kill the host cell, kill the pathogens, useless against the virus. Your time starts now.
Sir. Time, please, fast.
C.
Okay, so which statement is incorrect about the effective vaccine? The C, it kills pathogen. I am saying incorrect.
Oh shit. Shit.
Computer ji.
Incorrect.
Okay.
Correct.
Incorrect शब्द है ना.
Incorrect है.
Question 2. One disadvantage of using broad spectrum antibiotic is option A, destroy normal microflora, target host cell, extremely toxic, easily activated by the host. Your time starts now.
A.
Captain,
Answer is A.
Captain, sir.
Hello. Answer A.
Okay, Captain, तुम्ही उशिरा बोलताय. तुम्ही अगोदर बोललं पाहिजे. तर A आम्ही लॉक करतोय आन्सर.
Okay.
Yes, you're perfectly right. Congratulations. Okay. Moving to question third. Resistance to large number of antibiotics are called options: mutants, super bugs, super infections, beta lactam resistant. Your time starts now.
No, B. Beta lactam resistant.
Captain.
Superbugs.
B. Superbugs.
Okay, we are locking the B superbugs. मेहता सर ने आन्सर दिलाय. कॉम्प्युटर जी बघा काय आहे हे. अरे perfectly right. B. Neha.
Yes, sir.
Question 4 for the beta lactams. 3-year-old patient brought the chest pain, history of fever 3 days. And here's the X-ray picture for you. Choice of antibiotic, dose and duration. Your time starts now. Stable patient आहे, oral medicine सांगू शकता.
Oral amoxicillin.
Sir, dose duration detail सांगा.
50 milligram amoxicillin for 10 days.
So 50 mg for 10 days. Oh, okay. I am going to the expert board. And answer there. पकडता येईल आपल्याला.
Stable to 100 pneumonia. 50 to 100 milligram, 3 divided doses for 10 days.
50 to 100, na?
Given 50, I will accept it.
Okay,
Yeah.
that's okay. We are taking this answer. Neha, please check 10 answer.
Okay.
We are taking this. We are giving to you. Neha, त्यांचा round first संपलेला आहे. खत्म हो गया. उनका कितना स्कोर हो गया?
They have scored 30 points.
Okay, congratulations. So फर्स्ट राउंड यहीं पे खत्म होता है. बिफोर एंड रैपिड फायर एक बार स्कोर अपडेट कर दीजिए.
Yes, sir. After the end of round 1, Team Penicillin has scored 10 points, Team Cephalosporin 30, Macrolides 10, Quinolones 40, and Beta-lactam 30.
ओके, सो द क्विनोलॉन्स आर लिडिंग. कॉंग्रॅच्युलेशन. मला वाटतं आमचे क्विज बँक जे आहे, आता आपण रॅपिड फायरला जाणार आहोत. तर टीम पेनिसिलिन, आर यू रेडी? बाकीच्यांनी सगळ्यांनी आपला व्हिडिओ ऑडिओ ऑफ करा. टीम पेनिसिलिन कोण आहेत कॅप्टन?
हाय सर.
येस. हा, येलो टी शर्ट. आय एम आता फक्त ह्यांना येऊ देत, गंगुलाजींना. फक्त थोडे रूल सांगतो की तुम्हाला 8 प्रश्न विचारणार आहे.
बरोबर.
त्यांचं टायमर स्टॉप होण्यापूर्वी ते 8 प्रश्न संपले की एक अदर 8 प्रश्न फर्स्ट किंवा टायमर प्रश्न रिपीट केला जाणार नाही. यू हॅव टू आन्सर समथिंग. येत नसेल तर पास असा म्हणा तरच नेक्स्ट प्रश्न मी विचारणार. यू आर गोइंग टू स्कोर 5 आणि कोणतरी एक जण आन्सर द्या. डिस्कस करत गेला तर ते 8 प्रश्न अगदी सोपे प्रश्न आहेत. देयर इज चान्स यू कॅन स्कोर फुल मार्क्स इन दिस. गंगुलाजींना येऊ देत जरा, आपण हे करूयात.
ओके. तुम्हाला आलं?
Yes, yes.
Okay.
Yes, rapid fire round 2 for team penicillin. Gangulaji.
Yes, instruction सर्व सांगितलंय ना तुम्ही?
सांगितले sir.
So team penicillin, all 4 are there. Dr. Neha, please check their videos on icon. Yes. So we are going to this rapid fire round. Once I start clinicking, the questions will come, and if you know the answer, answer promptly, or if you don't know, make it pass. So team penicillin, your time, Jay, you will take the questions, huh? तुम्ही बोलला ते question. So your time starts now.
बसू दे त्याला. Antibiotics kill both bacteria and viruses that cause illness. True or false?
False. False.
All antibiotics are safe to take during pregnancy and breastfeeding. True or false?
False. False.
If you are colonized with the bacteria, does it mean you have an infection? Yes or no?
No.
Narrow spectrum drugs are preferable because they are less likely to be harm beneficial bacteria. True or false?
True.
Which is the gold standard initiation of the typhoid infection?
Vidal, sir. Vidal test. Culture.
Azithromycin,
culture, sir.
first drug of choice to treat the acute tonsillitis. True or false?
True.
आपण एक क्वेश्चन अजून देतो त्यांना बस.
नाही झालं. Time is over. So their answer first question correctly true. Second question also they are correctly true. Third question they are also correctly answered true. अरे राहू दे ना ते. And fourth question also they correctly said true. And the paswa they said the Vidal actually is a blood culture. Azithromycin they also treat the true.
ते झाला नाही, ते क्वेश्चन नाही झाला.
हा नाही झाला तो. They have scored 4 correct. तो नेहा
चेक कर परत
केले
बरोबर आहे
20 मार्क्स. ओके, टीम Cephalosporin, congratulations. They have scored 20 marks. Next team Cephalosporin. कोण आहे तुमचा कॅप्टन? कोण आहे? कोण आन्सर करणार आहे? वेस्ट
डॉक्टर रवी म्हात्रे विल आन्सर.
कुठे आहेत म्हात्रे?
Please switch on your camera.
व्हिडिओ.
डॉक्टर नेहा, प्लीज चेक द व्हिडिओ अँड
व्हिडिओ. म्हात्रे कुठे आहेत? मयूर तुमचा बंद करा व्हिडिओ.
नाही,
मयूर आहेत का? कोण करणार आहे?
मयूर, ओमकार आणि अमित. प्लीज चेक.
ओके, म्हात्रे सर लक्ष देऊ. आर यू रेडी सर?
Yes, sir. Yes.
Question starts.
Dr. Jay, Dr. Neha, please check all these videos should be on. Mayur, Ravindra, Omkar and Amit. None of the videos should be off.
चला चालू.
ठीक है?
Yes,
sir.
So team Cephalosporin, your time starts now.
Many antibiotics only work against certain type of bacteria. True or false?
True.
Antibiotic kill both good and bad bacteria. True or false?
True. True.
Which antibiotic starts with letter D?
Doxycycline.
Cefixime can be used to treat acute tonsillitis. Yes or no?
No.
Yes. Yes.
Team
Wrong.
leader.
Wrong.
No.
Is pneumonia common in pediatric? Viral or bacterial?
No, sir.
Bacteria.
Bacterial.
Strongly positive without test on day 2 of fever is diagnostic of typhoid fever. True or false?
False.
Tuberculosis is notifiable disease.
Yes.
Yes or no?
Yes.
All antibiotics can cause antibiotic acid diarrhea. True or false?
False.
No. False.
अरे हो फक्त दिघे सरांनी उत्तर द्यायचं आहे.
ट्रू त्यांनी ट्रू घेऊया आपण
True दिले ना. हा ठीक आहे. चला
False.
आन्सर चेक करा.
आता बघा आता
पहिला मिनिट yes, they are correctly answer. First question, antibiotic is there are correctly answers true. Which antibiotic starts? Doxycycline उत्तर आलं होतं का?
आला होता.
Correct. Cefixime can be acute tonsillitis. They said yes. Actually, the answer is no. Which pneumonia? They said bacterial. Actually, viral common आहे जास्त.
व्हायरल सांगितलं.
नाही तिघा चौघांचं उत्तर नाही फक्त कॅप्टनचं उत्तर.
बॅक्टेरिया आला पाहिजे.
And strongly without test on day 2 is diagnostic. They said false. That is correct. Tuberculosis notifiable disease.
Yes, सांगितलं.
Yes.
सांगितलं.
All antibiotic can cause antibiotic associated diarrhea. They said
True.
झाले 1 2 3
6
दोन चुकले.
4
दोन चुकले.
हा 2 चुकले. तो 6 are correct.
दोन चुकले.
30 द्या स्कोर 30 मार्क. नेहा लिहून टाका. Yes. तर टीम मॅक्रो लीड. पुढची टीम
Video.
मॅक्रो
Yes, sir. Yes, sir.
Yes, sir. Yes, sir. We are ready, sir.
Yes, sir. Ready.
Yes, sir.
कोण आन्सर
Yes, sir.
करणार आहे?
Dr. Satya.
सत्या
Dr. Satya.
तुम्हाला बरं पडेल. तो गोंधळ होणार सगळा.
डॉक्टर निया प्लीज चेक द व्हिडिओज ऑफ ऑल.
ओके, आर यू सत्या सर तुम्ही रेडी आहात का?
Yes, ready. I am ready.
हा
नाही चौघांचा बघा व्हिडिओ.
तुम्ही आन्सर चेंज करताय. एकच आन्सर द्यायचंय.
हो पण तरी व्हिडिओ ऑन करू दे त्यांना.
I have
व्हिडिओ ठेवा.
3 of them.
ओके,
सत्या, सचिन.
सत्या सर रेडी आहेत का?
Ready, sir. Ready.
हा चला. Your quiz rapid fire starts now. Eosinophilia is a marker of bacterial infection. True or false?
False.
What is quinsy?
Peritonsillar abscess.
Montauk test is a diagnostic of TB. True or false?
False.
Steroids can be used to treat pyrexia of unknown origin. Yes or no?
No.
Drug of choice for loose motion in exclusive breastfeed baby of 4-month age.
Just avoid the milk.
Multisystemic symptom is a feature of viral illness. True or false? You can attempt.
True.
बस.
Okay.
True.
चलो. I will check. Eosinophilia is a marker of bacterial infection. You say false. Actually, it is true. What is quinsy? I heard peritonsillar abscess was. ठीक, we'll give it to you. Montauk is diagnosis of TB. You said false. That is also correct. 2 correct. Steroid can be used to pyrexia of unknown origin. They said
No.
That is also correct. 3 correct. Drug of choice for loose motion. They said कि no milk. Incorrect.
they said milk खाली milk देने का बोला बस.
नहीं. They said not to. That is wrong.
Wrong.
No, not to give milk. That is wrong.
And multisystem symptom feature of viral illness. They said true.
True.
तर 4 बरोबर आले. 1 2
पहिला काय सांगितलं त्यांनी फॉल्स सांगितलं का पहिला.
हा false. 4 कर
1
4
2 चुकले 4 बरोबर.
4 बरोबर आहे.
20 मार्क. चलो टीम क्विनोलोन. Are you ready?
20 marks.
Quinoline.
Yeah.
Team Quinoline, please. कोण आहे कॅप्टन लक्ष देणार मी
सिद्धू सर
व्हिडिओ ऑडिओ ऑफ करा प्लीज.
येस कमिंग 2 मिनिटं. येस यू आर आन्सरिंग.
करणार आहे कोण करणार आहे सर
मी
कॅप्टन बोर्डवर करा मला मी तुमच्या लक्षात उत्तर.
Please other make the audio off. Disturbing sounds येतोय.
चला तुम्ही सर रेडी आहात. ओके टीम किनोलोन कॅप्टन.
Yes, sir.
Your rapid hour starts now. What is contact tracing?
Finding the contacts of the deceased person.
Okay. What is the dose and duration of cefixime in typhoid fever in children?
8 milligram per
50 mg per kg.
15 mg per kg body weight.
body weight.
Captain.
50 to 60 mg 12 hourly.
आगे aspirin can be used for treatment of viral fever in pediatric patients. Yes or no?
No.
Anaphylaxis should be treated with injection at which route?
Subcutaneous route.
Subcutaneous route. Which vitamin is given in measles?
Vitamin C.
Drug of choice to treat pertussis?
Clarithromycin. Macrolides.
What is the long form of NSAID?
Non-steroidal anti-inflammatory drugs.
What is impetigo?
It's skin disease.
नाही संपला तुमचा ठीक आहे.
Vesicular eruption.
Okay. What is contact tracing or the correct contact जे आहेत त्यांचे सगळे ट्रेस करायचे इनिशिएट करायचं. We'll give to them. First is correct. Duration of typhoid fever 20 mg per kg per day for 14 days. It was incorrect. Aspirin.
Correct, na sir?
नाही नाही तुम्ही 15 to 60
No,
सांगितलं.
15 to 20.
15 to 20 बोलला. 15 to 20.
15 to 20, sir.
No, but dose is 20 only, not
20 only.
15.
15 पण नाही.
Dose is not 50. It's 10 milligram per kilogram per dose 2 times
Sir,
a day for
8
10
mg
days.
per kg body weight actually.
नाही नाही
No,
नाही.
No.
no.
We're talking about the typhoid fever, sir. आपण टायफॉइड fever बद्दल बोलतोय.
हा,
Dose
typhoid fever मध्ये
20
double dose
milligram per kg per day divided 2 doses for 14 days. Not given. Aspirinचा ऍक्शन तुमचं बरोबर आहे. पहिले दोन बरोबर. Third is correct. Anaphylaxis you said that subcute. Actually it's intramuscular. Please remember लक्षात ठेवा. Anaphylaxis मध्ये intramuscular द्यायचं असतं. Only 2 correct. And you say vitamin C. Actually it's vitamin A. Measles मध्ये दिलं जातं. ड्रग ऑफ चॉईस नॉट कॅलिथ्रोमायसिन इरिथ्रोमायसिन. NSAIDचा आन्सर तुमचा बरोबर आहे. आणि वाटतं इम्पॅक्ट घेऊन तुम्ही अटेम्प्ट करू शकणार. तर तुमचा 1 नंतर 2 नंतर किती 3 बरोबर आले तुमचे. तर दे आर स्कोर 15 मार्क्स. टीम किनोलोन लिहा मॅडम.
Yes, sir.
हा चलो लास्ट फायनल बीटा लॅक्टम. आर यू रेडी?
Yes.
सर तुम्ही फक्त आन्सर करा बरं पडेल नाही तर सगळा गोंधळ होतो. हा चालेल.
Okay.
कॉम्प्युटर जी
Your time starts now.
now. Okay. What is long term of PCR?
Polymer chain reaction.
Polymer chain reaction.
Captain. Drug of choice in
Chain reaction.
infection.
Vitamin D.
Drug of choice in reaction. Doxycycline.
Oh, Captain answer करायचे sir. Antibiotic choice in viral hepatitis.
No antibody. No antibody.
Dose of ceftriaxone in bacterial pharyngitis in kids.
8 to 10 milligram per kilogram of divided.
Can we use amoxicillin as a step down therapy in ceftriaxone treated pneumonia? Yes or no?
Yes.
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 Starting antibiotic on first day of fever in stable pediatric patient will prevent the further complication infection. True or false?
False.
We should change antibiotics on day 3rd if patient not respond to treatment. Yes or no?
Yes.
Okay, time is off. So correct. तुमचे what is the long form PCR was correct. Drug of choice मी vitamin D ऐकलं तेव्हा.
नाही they said
Doxycycline म्हटलं.
Okay, second is correct. Antibiotic viral hepatitis they said no antibiotics. Third is correct. त्यांनी डोस 8 to 10 milligram per सांगितला. सर द्यायचं का मोहिते सर?
हो द्यायचं.
Third is correct. Fourth is also correct. And in amoxicillin they said yes, that is also correct. Third, sixth also correct. And seventh, what they said?
No.
6 बरोबर आले. 7वा अटेम्प्ट केला होता का टायमिंगच्या मनाने?
पण त्यांनी येस सांगितलं होतं, तर आन्सर इज रॉंग.
येस म्हटले, ते चुकले त्यांचे.
चुकलं. ठीक आहे, तर 6 करेक्ट आले. 30 मार्क्स. ओके नेहा, फाइनल स्कोर बताओ. चलो, लेट हो रहा है.
Yes, sir. At the end of round 2, Team Penicillin has scored 20, Team Cephalosporin 30, Team Macrolides 20, Team Quinolones 15, and
टोटल स्कोर बता दो. टोटल स्कोर सबका, राउंड 1, राउंड 2.
Team Penicillin has scored 30, Team Cephalosporin 60, Team Macrolide 30, Team Quinolones 55, and Team Beta-lactam 60.
ओके.
काय झालं रे?
काय झालेलं आहे? ओके. So congratulations to team both cephalosporin and beta-lactam. So congratulations. काय क्वेश्चन घ्यायचे आहेत का राहू द्यायचं?
टाय क्वेश्चन्स घेऊया आपण. काय करूया टाय क्वेश्चन्स कसं करायचं? टाय क्वेश्चन
3 विचार लागेल. जे पॅटर्न ठेवलाय तसंच घ्यावं लागेल.
3 क्वेश्चन घेऊया का?
हो आणि त्यानंतर
नाहीतर असं 3 क्वेश्चन घेऊया. मी बंद करा जरा, आवाज बंद करा. साऊथ रायगड अजून वेळ आहे सेलिब्रेट करायला.
नंतर अजून वेळ. वेस्ट रायगड कोण आहे? cephalosporin कोण आहे?
Finally with the scores we have tie between cephalosporin team, that is West Raigad, and beta-lactam team, that is South Raigad. So West Raigad and South Raigad we have tie questions set of 3. So first which team I will
West Raigad. Ready?
West Raigad. So we will go according to that sequence. So I will just share the tie PPT.
From West.
Sir, it's a multiple choice or rapid?
Multiple choice.
मल्टिपल चॉईस आहे.
मल्टिपल चॉईस.
आणि दोन्ही टीम एका वेळेस देतील की एक टीम आन्सर करणार आहे?
नाही. एका वेळी तुम्हाला 3 प्रश्न, दुसऱ्या 3 प्रश्न असं विचारणार.
ओके सर, थँक्यू.
टाय क्वेश्चन्स ला काय करूया? इन द मीन टाइम जस्ट आय विल एक्सप्लेन द थिंग. देयर आर these 3 questions set. So team West Raigad first will attempt 3 questions and we will see the order. We will give 10 points each, and then we will have the 3 questions for East South Raigad. Then we will take that their score. If again there is a tie, in the meantime Dr. Mohite can think of 3 questions useful for general practitioners. We can take direct verbal questions from Dr. Mohite. Dr. Mohite sir, you just prepare 3 questions, easy ones for the tie. If this happens, also we tie, and if that also happens to be tie, then we will declare a joint winner. Okay, that's right. Okay. Mohite sir आहेत ना?
हा मी आहे.
हाँ sir. 3 क्वेश्चन बना. If our
रेडी.
our
कोण आन्सर करणार आहे? आन्सर कोण? मयूर तुम्ही करणार आहे? अनम्यूट करा.
आन्सर करतो सर.
चला पहिला सेट घ्या. चला टाइप क्वेश्चनचा.
हा एक मिनिट. मला कुठे
वेस्ट रायगड फॉर्मात आहेत आमचे मेंटॉर. लगेच उठून बसले.
मग स्टुडंट
राजेंद्र सर.
And from team South Raigad, who is going to answer?
कल्याणी सर. येस, मयूरकडे फक्त बघणार मी आता. आणि 10 सेकंदच येतात फक्त. पटपट आन्सर करायचंय. 1 2 3 4 5 6 7 8 9 10.
See now one more thing. Before we take up the tie questions, Dr. Neha, whenever the question gets displayed and when Jay sir said your time starts now because we don't have timer on the slides. तर नेहा आपको देखना है 15 सेकंड हुआ तो बोल देना टाइम अप. ठीक है?
Okay sir.
हाँ डॉक्टर नेहा, आफ्टर डॉक्टर जय सर से टाइम स्टार्ट्स, तो आपने टाइम देखना है 15 सेकंड और बोलना है. सो वी आर गोइंग टू द
नेहा मैडम, आपका स्क्रीन पे मोबाइल दिखाओ.
अरे टेंशन मत, एवढं घेऊन करू नका हो. ठीक है.
इतना विश्वास रखो. डॉक्टर नेहा मैडम इज वेरी पर्टिकुलर.
राजेंद्र
She is one of the sincerest hard worker, dedicated of IIP Raigad. So we believe and trust Dr. Neha Singh.
Okay.
Yes. Okay. So we are
first.
Dr. Jay. The team is West Raigad Cephalosporin. So just I will put a question. Just let us go. A blank slides yes.
Which are the following are shown a resistance to oxacillin? A. Pneumococci, B. Meningococci, C. Staphylococcus aureus, option D. Haemophilus influenzae. Your time starts now.
D.
D what?
Mayur, it's C. C. Mayur, it's C.
Mayur. Mayur, Patkan.
Answer is C.
Okay. Staphylococcus aureus. ठीक है. Answer बघा. Okay. Congratulations. You are scored. Neha, ध्यान रखो. Question 2 for the team cephalosporin. Multidrug resistant tuberculosis, MDR-TB is defined by the CDC as a M tuberculosis bacillus that resistance to at least A. isoniazid, B. isoniazid rifampicin, C. isoniazid rifampicin and fluoroquinolone, and D. isoniazid rifampicin, fluoroquinolone, and at least one second line drug.
Mayur, it's D.
Your time starts now.
Mayur, it's D.
D. No, it's B, na, I think.
B.
No.
B
B
for
for
ball.
ball.
B.
B for ball.
B for Bombay. Booked it.
Okay, locking the answer B for Bombay. Sanga answer. Computer ji.
Yes.
Perfectly right. B is right answer. Now the question third for tie round for the team cephalosporin. एकदम सूर्य कुमार यादव सर कहता proper vaccination of medical staff and patient to prevent infection is effective method to prevent the spread of all the following except Staph aureus, H. influenzae, S. pneumoniae, and meningitis.
Mayur, I
Time
think it's
starts
D.
now.
Sir, it's A. Aureus.
Mayur A.
Answer is A. Aureus.
Okay, Staph aureus is a locked answer for team cephalosporin. Answer baga. Okay, answer is A.
Congrats, man.
Oh. Correct. So they are scored 3. 3 चौके मारले. They are scored 30 marks. Neha लिख लो. Team Beta Lactam, are you ready? Mehta sir.
Yes, sir.
हाँ. कसं वाटतंय मेहता सर तुम्हाला?
छान वाटतं आम्ही टेन्शन नाही करत.
Okay. तुमचे चेहरे सांगतात you are enjoying. That is more important.
Yeah.
Okay. So, computer ji. Team 2, question 1. Which of the following considers the aspect of prevention of transmission of resistant microorganism? Which of the following considered as the aspect of the prevention of transmission of resistant microorganism? A. Cohorting patient, vaccination patient, judicious use of new antimicrobials, restricted use of broad spectrum antibiotic. Your time starts now.
Restricted use of
D.
D for donkey?
Yes.
Okay. Chala, your time over the answer. Chala, computer ji. Answer is A. Cohorting patient is the considered aspect of prevention of resistant. Okay. So moving with the question 2 for the team South Raigad. Antimicrobials that inhibit the growth of microbes are referred as microbicidal, beta-lactams, microbiostatics, aminoglycosides. Your time starts now.
Statics. Growth of microbes.
Time answer the पटकन.
Time stop.
B.
Time is up. Sorry.
Take answer. काय बोलले ते बोलले.
चला द्या सर answer द्या पटकन द्या चला. Choose one.
B.
D बोलले ते. D बोलले D.
D का ठीक है. काय?
D बोलले ते.
B.
D aminoglycoside. Okay. ठीक है.
B for Bombay.
D for Bombay. Okay. बघा काय answer? C है answer. काय static होते. Inhibit growth है ना. Inhibit growth है static आणि kill करता ते sidal असतात. Okay. Third. Question third. Yes. How do bacteria acquire mutations that make them resistant to antibiotics? Option A. Novel mutation in the DNA of bacterial cells that lead to mechanism that counteract effect of drug. Second, acquisition of new genes via sharing DNA from bacteria to bacteria, and both A and B, none of above. Your time starts now. Time starts, time. काहीतरी choose करा.
Acquisition of new genes by sharing of DNA from other bacteria.
So B option they are chosen. Computer जी देखो क्या हो गया है. Oh, answer both mechanism. Answer both A and B. दोनों. हाँ, okay. नेहा क्या स्कोर हुआ उनका? No score, okay. ठीक है, no problem. I congratulate all of them. They played very well. I know it is very late. आपण एक एक्झॅक्ट 35 मिनिटं आपण नॉर्मली विचार केला होता की 9:30 चालू केला तर 11ला संपेल, पण ब्लेसिंग्स या गोंधळामध्ये 11:30 झाले. तर मला वाटतं नेहा हु इज द फायनल विनर, तो आप डिक्लेअर कर दो चलेगा.
Team Sepharo's West Raigad is the winner.
क्या बात है. The boys have done well.
For me, all are winner because another thing, म्हणजे almost they have answered very well. And खरं तर हा फार मोठा स्पेक्ट्रम होता, म्हणजे स्टार्टेड फ्रॉम सिम्पल व्हायरल टू बॅक्टेरियाज आणि हे नंतर पुढे म्युटेशन वगैरे. ऍक्च्युली जरी आय ट्राय टू इन्क्लूड ऑल.
Dr. Jay, before we take the comments from everybody, we will just ask experts to give brief remarks. First, Dr. Ramakant sir, then Dr. Mohite sir, Dr. Nimen sir. Then we will go to the winners and runners up. Yes, Dr.
एक्सपर्ट झोपायला जायला मोकळे होते.
Dr. Ramakant.
Yes. Wonderful. I congratulate Team Raigad IIP for taking this wonderful initiative. Very nice questions. Very nice, crisp and take-home message. And I 100% agree with Dr. Jay that all are winners. The enthusiasm which was displayed, it was infectious. So very nice, and everybody has learned. Very nice initiative. Wonderful.
Dr. Mahesh Mohite sir.
Yeah, Dr. Ramakant, you will agree that this kind of pattern should be installed in every district, because we discuss this antibiotic prevention only in IIP platform, and I'm sure over the last 20 years we have seen drastic decrease in consumption of antibiotics in the pediatric practice. But unless the general practitioners implement the same thing, it will not really be a mass kind of a movement. So this is a wonderful kind of a thing which on the state platform, Dr. Ramakant, you are already active in that. You can tell it to your next, when you are changing the patterns. This is something which should be implemented in every district, because this will at least stimulate the practitioners what should not be done. I think in the antibiotic, what is more important is what should not be given rather than what should be given. So this is a wonderful effort by Team IIP. As usual, we are innovative in most of the things. We are having accolade and kind of a privilege of starting something new, which has been taken by the state. So this can be one thing which can be again taken by the state in a statewide. Thank you very much. It was absolute wonderful listening, and congratulations, Team West Raigad, doing wonderful job all along. And of course, other teams also perform well. I can see the discrepancy and kind of sometimes it's bad luck that you got the bad questions. So don't feel bad. You could have easily answered the ones which the winners answered. You can always say that. And let's go with the happy memory of this quizzing. Thank you very much.
Dr. Mohanty sir, please.
Congratulations to all the participants. Your response was very, very prompt. It's from the very general practicing pediatricians or general practice oriented questions were there. It's not that we selected questions of a difficult type or tricky type. It's not that. For general practitioner oriented questions. See, in the last, if you see last 50 years, not many antibiotic, they're not in pipeline now. In 2018, only 2 antibiotics were discovered, allowed. Earlier, maybe 50, 60 antibiotics used to come per year. Now, this has down to dried up. This pipeline is dried up. If we are not careful, who do not know what will happen to the human race. Another aspect of this is they're using a lot of antibiotics in the poultry, in this meat farming. So that is also spreading the resistance. So this should be curbed by the government, and our social activists should take up. Not only that, doctors will restrict the use of antibiotics. In the social and the commercial sector also, these things has to be looked up. And very well done, friends. At this almost going to be 12. So your concentration matters, keeping you alive and active, that matters. I'm very good. Congratulations to every one of you. Thank you.
Thank you, sir. One or other are starting leaving. So for next 10 minutes, we will just go across because Vikas has raised the hand. Just first we'll go to Vikas, then we'll go to the mentors, whoever is present, and then we'll go to the runner-up team and the winner-up team, and then we'll wind up the session. For next 10 minutes, we will do all these things, and we'll just stop after 10 minutes. So Dr. Vikas, you have raised your hand. So you want to say something? Ideally, I wanted to ask you that last, but if you have raised the hand, please go ahead.
First of all, I congratulate the winner team and all teams. Everybody was emotionally and mentally involved, and it was really a fun. The people are awake till the late night, till 12 o'clock. It's a proof that in spite of the India-Australia match, the people are glued to the this thing quiz. So it itself reflects the kind of effort taken by Gangulia sir and Jay sir, and very well supported by Dr. Neha. And again, I hope that this initiative will be again taken to the state level and national level to increase the awareness. And we will definitely send the certificates by email to all those who the winner participant. Neha will be doing the needful.
Thank you, Dr. Vikas. Besides certificate, there may be some more prizes also, I think so. But
Yeah. I was feeling like how to announce, but from my side, I announced the prize of 5,000 rupees to the winner team, and 3,000 rupees to the second team. So that is from my own pocket. That is the own
RMA function, where in the inauguration function, that during the RMA annual conference, we will do this thing. So you just award them there. And
surely.
And the RMA annual conference will be at Panvel, and probably I think it is 6th and 7th January. Okay.
Surely. Yes.
So we move ahead, and I think so. Mentors are there. Just whoever the mentors are present one by one, you can go. I see Dr. Vankade sir. Yes, sir. Please.
Yes, congratulations to winner team and runner team also. And really, by this means of quiz, it spread the use of antibiotics, proper use of antibiotics. So congratulations, IIP Raigad and RMA. Thank you.
Dr. Rajendra.
Yeah, thank you, sir. I feel at the end of the day, IIP Raigad and RMA are the clear-cut winners of this session. Wonderful session hosted by Dr. Gangulia sir and the quiz master Dr. Jay. And it was a good opportunity for me, even as for me, to learn from experts like Dr. Mohite sir, Dr. Mohanty sir, and Dr. Ramakant Patil sir. And I really feel hard luck Team Mahad and hard luck my friend Dr. Sunil. But it was good opportunity to all the participants as well as all of them. And I thought my teaching reflected in my students. 3 of them are my students, and Dr. Ravi, my colleague. But I feel proud of them, and congratulations them, and congratulations all the participants. Thank you very much.
Rajendra sir, I think you will give them party in Radisson.
Of course, yes, of course. That goes without telling.
And along with quiz master and quiz coordinator. Huh? And Professor Rajendra is on right track, I think so. Yes, Dr. Sunil.
Sir, I am here only.
Your comments as a mentor.
Yes. Congratulations, Waste Raigad team for winning this competition. And we are feeling a bit depressed But still we have won the prize of around 3,000 rupees, so we are going to celebrate it. It's an innovative idea of giving the take-home message to all the general practitioners, and I think this should be implemented in each and every taluka place. And it should, I think, IIP Raigad should take it as an initiative where each and every taluka we can have this kind of quiz to give the message to all the general practitioners to how to the antibiotic abuse has to be stopped. So because it's a idea to you, and we'll proceed with it. Thank you.
The ideas not to be given but to be implemented by the talukas. So Maha Taluka, Dr. Sunil said will be going to organize quiz for the Maha Taluka and alone. Okay.
Yes.
It's all our individual responsibility to go about it. So I think so. We are missing Dr. Uddhav Khilare and Dr. Anand Bagle. They doesn't seem to be here. And before we go to the runners up and winners up, and lastly Jay, just I will ask our Dr. Neha Madam, who has wonderfully prepared the flyer and message which has been drafted, circulated all around the groups. This work was done, the making of the flyer, everything was done by Dr. Neha. She is an active IIP Raigad, and at present she is a Maha IIP Women Committee co-chairman. So has just coordinated all the things at the state of Maharashtra also. So I will ask Dr. Neha to please give her comments.
Thank you, sir. Thank you so much, sir. Winning and losing, I think so it's not so important, but main is important is I give importance to the participation. And today quiz, all the participants and all the teams have participated with great zeal and enthusiasm. And I congratulate all the team, the participants and the mentors. But special congratulations goes to West Raigad and Rajendra Chandorkar sir being the mentor, and congratulations. And I think so we will continue this quiz, not only antibacterial quiz but other forms of quiz in later months also. Dr. Jay sir and Dr. Gangolia sir will be organizing them. Thank you so much.
Thank you, Dr. Neha. And always whatever the feedbacks we get from the participants is much more important to organize such a programs. So I think so rather going to runners up and winners, there is one participant from North Raigad. I see Dr. Satya. Please can give your comments, Dr. Satya, if you are there. How did you felt during participation of this quiz?
Yes, sir, it was a great fun with the knowledge and the guidance by all of you, sir. It's a great initiative by Team IIP and Team Raigad. I'm very happy to participate in this program. Special thank to Dr. Vikas sir. He is specially selected by them from Uran, North Raigad. It was a great fun with knowledge session, sir. And very thank you to Gangolia sir, Ajay sir, and especially thank to Mohite sir and other sirs. They are giving a very good tips, which is helping us in our day-to-day general practice. It was a very informative session. Thanks to all of you.
Yes. Thank you, Dr. Satya. Thank you for your participation. And you are really participating in the quiz is very difficult. And none of them they come forward, but you have come forward. That is only you are the winner. That shows you are the winner, true winner, that you have participated in the quiz. And so now we are left out with the runners up. Runners up are the South Raigad beta lactams. And so South Raigad, please give your comments. How did you felt? Doctor, the senior most having 45 years. Dr. Mohan sir, just give your comment, just what you felt during this participation quiz. Yes, Dr. Mohan and colleagues.
We have enjoyed it, but little bit depressed that we are.
Yes, anybody want to?
It's a very good program. Actually, you should take once a 6 months this program.
We are seeing that yes, we are seeing the women reservation bill coming on, but in this quiz we are seeing only 2 women here, only one, Dr. Trupti madam. Dr. Trupti, yes, yes, Dr. Trupti, you want to say something?
Yes, sir. Actually, sir, we should run in. We should be in second round 2 also, but one silly mistake happened and we got in the tie round. And because of all pressure, we lost all the answers incorrect. And lost.
So see, this is part and parcel of any quiz, any part and parcel. This is part and parcel of life. So
Yes,
always there is 1% luck, 1% destiny, and otherwise is a hard work, whatever we are doing.
But we are happy, sir. We are happy.
Yes. Thank you very much. Now we come to the winner of this all West Raigad. They can make the video on. So West Raigad, all 4 participants, if they want to say, they can say one by one. Lastly, team leader. Yes, Dr. Omkar.
So last year we were runner-ups. So this year,
I
this year
believe
Sandokar
it.
sir tell us we have to win this. So we tried.
Yes.
Thank you.
Dr. Amit. Amit, आहे का? Dr. Amit.
हॅलो.
Yes, Dr. Amit. Go ahead.
हा सर खूप चांगला प्रोग्राम होता आणि खूप इन्फॉर्मेटिव्ह प्रोग्राम होता आमच्या जनरल प्रॅक्टिशनरसाठी. ज्यांनी कोणी हा मनात आला प्रोग्राम त्यांचे खूप आभार. खूप चांगला प्रोग्राम त्यांनी सुरू केलाय आणि असाच प्रोग्राम चालू राहूय.
डॉक्टर अमित, तुम्ही खरं सांगितलं आणि प्रत्येकाने खरं बघायला गेलं प्रत्येकाला आपली जबाबदारी आहे. आपण प्रॅक्टिस करत असताना शेवटच्या अखेरी आपण किती प्रिस्क्रिप्शन मध्ये अँटीबायोटिक दिले ते बघायचं आणि आपण फॉलो करायला. सेइंग इज इझी, बट खरं जे प्रॅक्टिस करणं, इम्प्लिमेंट करणं खूप डिफिकल्ट असतं. वी शुड ट्राय आवर लेवल बेस्ट. नाईसली सेड डॉक्टर अमित. डॉक्टर मयूर.
थँक्यू सर.
Dr. Mayur, Dr. Omkar, are you there? Dr. Mayur.
Sir, he just left. There is emergency patients.
Yes, madam, आप बोलिए ना, कोई बात नहीं. मैडम मयूर के लिए पे आप बोलिए, कोई बात नहीं. सर किधर? राज कल्याणी सर किधर है?
No, sir, दोनों वो LVF का पेशेंट है, दोनों नीचे गए.
आप बोलिए सर, कोई प्रॉब्लम नहीं मैडम, आप बोलिए.
सर एक्चुअली मैंने नहीं अटेंड देखा था. जस्ट सर अभी बोलती.
Yes, thank you very much. So with that,
Dr. Ravi is there, sir. Dr. Ravi is there.
Yes, Dr. Ravi. Dr. Ravi.
नमस्कार सर.
सर
नमस्कार सर.
रवींद्र.
तुमचा फारच हा फारच तुमचा स्तुत्य उपक्रम आहे. आम्हाला जनरल प्रॅक्टिशनरना या निमित्ताने पुन्हा एकदा अभ्यासाची वेळ मिळाली. आमचं मेंटर चांदोरकर सर यांनी आमची फार तयारी करून घेतली. त्याच्यामुळे आमचं सारं श्रेय आम्ही मंत्रालयाला सर चांदोरकर सरांना देतो. आणि आम्हाला याच्यातून क्विज मधून खूप काही आम्हाला सिनियर आणि मोस्ट मोहंती सर आहेत, मोहिते सर आहेत, त्यांनी आम्हाला खूप काही छान मार्गदर्शन केलं. थँक्यू व्हेरी मच फॉर अरेंजिंग सच प्रोग्राम्स.
थँक्यू रवींद्र फॉर दॅट गुड वर्ड्स. आणि हे सर्व साधून घेऊन जाणं, युट्यूब लाईव्ह रिले करणं, हे सर्व गोष्टी करणं. Our techno wizard Dr. Vishal is there. He always works from behind the screen. But मी रिक्वेस्ट करेन, विशाल तुझा चेहरा तरी दाखव. चेहरा नाही दाखवला तर 2 शब्द तरी बोल. डॉक्टर विशाल. डॉक्टर
2 मिनिटं.
जय 1 मिनिट, तो शेवट झालं. डॉक्टर विशाल इज व्हेरी इंटेलिजंट फेलो. कधी कधी आपल्याला वाटतं तो आहे, पण तो AI ऍप जोडून तो आरामात झोपून जातो. ही गेट्स एव्हरीथिंग रेकॉर्डेड बाय AI ऍप. So anyway, Dr. Vishal, if you are there, you can comment. Otherwise, we are towards the end of the session. We have to close the session. And before ending, it is Dr. Jay to conclude the session. और उसको कुछ शायरी बोलना है तो शायरी बोलिए. And we will end the session by telling it. Yes, Dr. Jay.
Sir, last
yes,
prize money has gone to their account of Rajendra sir and Sunil sir. You just check your account, sir. You got the money.
Yes, sure.
You got the money.
Yes.
Dr. Vikas is so proud president of IIP Raigad. आणि मला वाटतं असं रोज क्विज करावं आणि क्विज कोऑर्डिनेटर आणि क्विज मास्टरला सुद्धा काही पैसे द्यावे असे विनंती करण्यात येत आहे. आणि असे पैसे
मेरे दोनों हाथ ले लीजिए सर.
मेंटर्सला पण विकास मेंटर्सला पण पैसे देण्यात यावे.
मेरे हाथ दोनों हाथ ले लीजिए. I am sold out.
विकास, डॉक्टर पैसे आले. डॉक्टर सुनील तुझ्याकडे पैसे आले?
आले सर, मेसेज आला.
डॉक्टर राजेंद्र पैसे आले?
येस
येस.
विकास
पण टीमला सांगेन टीमनी ते
Live stream
default
मध्ये-
करून पैसे घ्याव्या, नाही तर ते पैसे ग्रुप
Sir, we are still live. Should I end the live stream?
नाही विशाल राहू दे काय प्रॉब्लेम नाही. विथ दॅट विशाल हॅज स्पोकन. विशाल 1 or 2 minutes. विशाल डू प्लीज कॉमेंट. विशालचं इंग्लिश फार छान आहे, छान बोलतो. विशाल बोलणार. विशाल चंद्र अजय कोहली वोट ऑफ थँक्स देणार आणि
अजय सर आता बोलून घेऊ द्या, हरकत नाही.
येस विशाल बोल.
अजय सर प्लीज कंटिन्यू.
विशाल तू पहिले बोल.
सर चालू दे ना. इट्स ओके.
अरे दोन लाईन सांगणार रे बाबा.
तुम्ही बोलतो अजय सरच जाऊन.
Yes, Ajay, vote of thanks and afterwards ending concluding remark by Jay with Shairi. Yes. Dr. Ajay. Ajay,
unmute कर.
Unmute कर. डॉक्टर विशाल बोलतात अजयला करू दे आणि त्यांना म्यूट करून ठेवलंय.
मी काय नाही केलंय सर.
Dr. Ajay has lost the signal anyway. We, on behalf of IIT Raigad, on behalf of RNA, we thank all the participants, all the mentors, all the experts, everyone, as well as quiz master Dr. Jay. And I will not take again the names. And special thanks to Dr. Neha. Special thanks to Dr. Vishal. Special thanks to Dr. Ajay, Dr. Vikas. Ajay has come. Ajay can say 1 or 2 lines. I have taken all the names almost. Dr. Ajay, please go ahead with 1 or 2.
I don't know. Sorry, sir. I don't know what technical glitch problem.
No
I had to come back. Yeah, I think it was a thrilling. It was like a thrilling match. So congratulations to all the participants and especially to the winning team. But I think everybody tried their best and everybody made good of the opportunity. And we have had some good insights. So as already thanks, I'll give the formal vote of thanks. Firstly, thanks to our president, Dr. Vikas More sir, for arranging yet another nice initiative for spreading good useful information. Then also thanks to Dr. Our chief guest today, Dr. Ramakant sir, for sparing his valuable time. Also our anchor, Dr. Neha Singh, for good presentation and also for keeping the scorecard well. Dr. Ganguly sir, Dr. Jai sir, for enthusiastically conducting the whole quiz and with complete smoothly controlling the whole proceedings. Next, our team mentors, team leaders, and all the team participants. Thank you and congratulations to all of you, and thank you for enthusiastically participating and making this such a successful initiative. And as sir has said, Dr. Vishal Raut, who is the backbone of our IT, our techno wizard, who always handles everything related to the IT. Thank you all. If I have missed anybody, please. And our experts for today, Dr. Mahesh Mohite sir and Dr. Mohanty sir and Dr. Mohite sir, for giving their expert comments and informative and useful information and explaining every part of the question and answers. Thank you all. I wish everyone good.
Yes.
Okay. Chalo, bye.
Thank you, Dr. Ajay. Before we close, I missed Dr. Bhavesh from Reese Raigad and Dr. Siddhesh. Dr. Bhavesh, tumcha comments while participating in this contest. Tumcha video band hota mala वाटतं. Unmute kara. And then
it was a great and very informative lecture. Hearing Mohanty sir and Mohite sir and all the experts, it's a great pleasure to us. And always you, Ganguly sir, you are always best in handling all these CMEs and all these quiz. I hope you continue with the same quiz. And Dr. Jai sir, thank you so much for handling very well this quiz. Thank you so much to all.
Yes, Dr. Jai.
Yes.
जय हो.
जय हो. आता मला 2 चेहरे फार खुश दिसत आहेत, राजेंद्र आणि सुनील. राहिला अकाउंट
पैसे आलेत अकाउंटला.
तुझी काळजी करू नको, मी तुला पार्टी देणार आहे. तुला आणि गंगोले सर आपण जरा प्रायव्हेट मध्ये भेट.
मी पण.
और नेहा भी है मैडम
नेहाला पण घेऊन बरं वस्तू. चलो बाय बाय.
ते जर तयार असेल तरच होईल, नाही तर करता येणार नाही, कारण प्रॅक्टिकली डिफिकल्ट हे सगळं तयार म्हणजे क्वेश्चन.
Please stop the live streaming.
Yeah.
कंक्लूड कर ना, जय कंक्लूड.
हा कंक्लूड तर थँक्यू व्हेरी मच.
मग लाईव्ह स्ट्रीमिंग बंद करणार.
हा लाईव्ह स्ट्रीम बंद करा चालते ना.
नाही तू कंक्लूड कर ना आणि मग
Thank you very much all. Not the enjoy. I was just want to take the feedback from the mentor. I was a question. राजन म्हटलं की मिलियम पर जी फार नकोय. पण मी असं जरा स्पेक्ट्रम ठेवला होता त्यावेळी क्वेश्चनचा. म्हणजे न्यूनेट पासून स्टेबल पेशंट, क्रिटिकल पेशंट आणि थोडं थेरॉटिकल मुद्दाम फार ठेवलं नव्हतं. थोडी काही ट्रिकी क्वेश्चन्स काही.
नाही छान होत क्वेश्चन सगळे सिलेक्शन चांगलं होतं.
वंडरफुल.
बरेच तयार केले होते, काही कॉपी पेस्ट केले होते 10%, पण ते हुडकावं लागतात म्हणजे. पण
गुड जॉब सर.
भेटत परत मग गेल्या वेळी आपल्याला प्राइस मिळालं होतं, यावेळी पण प्राइस बहुतेक मिळेल याला, कारण मला वाटतं याला. आणि कसं आहे ह्याला मोस्ट इम्पॉर्टंट म्हणजे पार्टिसिपेंट पूर्ण रायगडचं होतं. दॅट इज व्हेरी इम्पॉर्टंट. छान.
जब तक नेहा है तब तक प्राइज मिलने वाली है.
नेहा है तब तक प्राइज ही प्राइज है. प्राइजों की बारिश.
With that, we conclude this session.